Meeting to order.
4:40.
Thank you. Thank you. We'll call the meeting to order. I will ask, let's see, I do need a volunteer to be a temporary secretary. By the way, do you have the roll with you?
You have it in front of you. So
yes, I do.
Yep. So, and that's really all that's involved. I will.
Yeah, we're not doing.
It's not hard.
Volunteer.
Volunteer.
I'll be secretary.
Oh.
Is Chris here?
No.
Okay, we do need to have we'll probably appoint, we're not voting on anything tonight, but we would appoint somebody to fill in for Chris.
Yeah.
Could be you.
That would be James.
I don't know if I'm allowed or not.
James or Nick. Okay, who's volunteering?
I can.
Thank you, sir.
So-
Yeah, I do. Yeah. So if you could do the roll, please.
Wait, are
Thank
we
you.
recording yet, Bob?
Yes.
Okay, good.
Okay, Tom Schulte here, Talavieri,
Yep.
Michael Chen,
Here.
Chris Labrie,
No,
not here, Victor Alvarez,
Here.
Maria Weingarten,
Here.
Robert Hamill,
Here.
Cole Dowden,
Here.
Jim Jow,
Here.
Nicholas Matrakis,
Here.
Jan Schaefer.
Jan is not here. So I do need a,
I think we need to seat James for
Chris.
Or
Nick.
Nick.
Or Nick.
Nick for Chris.
Nick for Chris.
Nick for Chris. A motion to move Nick to sit for Chris Combe. Second, Maria, all in favor? Aye, opposed, none? Okay, so move.
Good.
You're bad at cleanup, Nick. All right, thanks very much. We don't have much we have no overview, so we can jump right into it. I think we have Health and Human Services up first. So Jen.
Sure. Yeah. I think you're big choice.
You want to come up? Yeah, I think it's best if you don't mind, come up here. How are you?
Wonderful. How are you?
Welcome. We're good, thank you.
7 o'clock on Thursday night. She's thrilled.
She's thrilled to be first.
That's
Yeah,
true.
that's
I know. I'm
You.
not surprised.
Okay. You ready?
Yes, over to you. Thank you.
Okay, Jen Iselson, Director of Health. Our mission statement is the mission of the Health Department to control preventable diseases through education, inspections, monitoring, by enforcing the federal, state, and local codes, laws, and regulations for maintaining and promoting public health. These are the 10 essential public health services by Connecticut General Statute. Every health department has to have a basic health program. State Health Department has adopted 10 essential public health services as that basic health services. Summary of major health department responsibilities. We're responsible for carrying out and enforcing all aspects of the Connecticut Public Health Code and all Connecticut General Statutes pertaining to public health. We license and inspect all food service establishments, hair and nail salons, and all cosmetology businesses, public pools, which includes condo and public and field club pools, septic and refuse trucks, private wells, daycares, lead inspections, septic inspections, and soil testing. We also review all building permits for properties on septic and/or private well. We are responsible for public health emergency preparedness of the CDC required deliverables. We provide case management of all New Canaan children found to have an elevated blood lead level of 3.5 micrograms per deciliter or greater. We manage infectious diseases such as COVID-19, TB, pertussis, norovirus, Lyme disease, STDs, foodborne illnesses, etc. We provide written comments for all P&Z and inland wetland commission applications for properties on septic and or commercial properties that are licensed regulated by the health department. We also respond to and investigate various complaints regarding landlord-tenant disputes. Next, the health department staffing requirements. These are our major things that we are required to have. You know, minimum is bachelor's degrees for me and my inspectors. I have to have a master's public health degree. These are all our licenses and certifications, many of which had to have, be maintained with annual training, and or some of them you have to retake, like the lead every single year, we had to retake that exam. I also, as the Director of Health by Connecticut General Statute, I'm on call 24/7. So when I go out of state or out of the country, I have to notify the Commissioner of Health and through an online portal. And our part-time medical director, Dr. David Reed, is my coverage in my absence. But when I'm on vacation in Connecticut, I'm just still on call. So that's just doesn't matter. It's really just when I'm out of state. So some major changes this year. We got online permitting through OpenGov launch. Thank you guys for last year expediting that process. I've been very, very happy with it. We launched on November 1st. The online this is the first year we also did the restaurant licensing right out of the gate on November 1st. So we were kind of the guinea pigs, but it went well. My staff also helped with anyone that had issues. They could come into our office. We had a computer set up and we walked them through it. We will be doing the salon renewal licenses in May and June. The public pools are also done in May. They have to be licensed and inspected prior to opening, which is traditionally Memorial Day weekend. And the septic and garbage trucks will also be relicensed through OpenGov in June. Last year, as we discussed, the unfunded mandate requiring health departments to provide QPR, mental health, suicide prevention training. That was launched July 1st. We do monthly trainings now every single month. Thank you to the library for providing us that space to do that. And all the sessions we've been doing have been full. So that's also good news. And the unfunded mandate has costs associated with, you know, every unfunded mandate that gets passed regarding the booklets and updated PowerPoint and certificates.
So just quick feedback on the system. Went up smooth, people using it. Any issues, any things that we need to do?
No, and I'm going to get into the next slide on some of the analytics of it, but it's been wonderful. Even the ones that were kind of hesitant and kind of fighting on it, not wanting it, now realize how much better it is, that nobody's coming in the office anymore. There's very few people going to the building department just on code questions. And the contractors love it because 24 hours a day they're submitting. The credit card payments and all that has been, you know, wonderful. I mean, in those few people that, you know, aren't good with the computer, we walk them through and help them do that.
So as advertised, that's what we wanted to do, what you just said. And you remember talking about the
And we were on budget, Todd. I promised you.
I didn't ask. I knew I was worried.
And, you know, part of saving the money to be on budget, we were taught how to, you know, create some of our own permits. So I built almost all the health department permits, except 2 of them. I learned more about coding than I ever wanted to learn, but, you know, it was a good experience. We got it up and running. Here's some of the analytics from November 1st until this week. The revenue brought in just those 3 months. This is for the 5 departments. The next one would be a breakdown of, and this is our dead time of year for building permits, just to be clear. November 1st through February 1st is the dead time of year. March 1st to October 31st is when it really ramps up. So like I said last year when we were presenting this, I do think we're going to see the increase in revenue. So by next November 1st, if we submit our budgets to finance in November, we'll have a really good idea
Full year.
And be able to next year propose increase, you know, revenue line items when we get that full year data. So this one gives you a count by the department. Those are standalone permits. So like for health department, for example, those are the 167 standalone permits that we have issued in those 3 months. That does not include all the building permits we've reviewed and approved, because that goes under the general building department. So when you're looking at like public works or planning and zoning or wetlands with the lower numbers, that doesn't mean that's all they've reviewed. It's just the standalone permits for those departments. And then, you know, with the road labels, I showed where my line items are. And then the credit cards, which we knew was gonna happen, is, you know, almost 3 to 1 people using the credit cards. So that's been huge, because for those that are new, we never had an option to provide anything other than a paper check. We were very, very archaic. So it's gone
Funny,
great.
I printed this out to prepare for the meeting, and I have this through January 16th, which must have been the first time you did it for
Yeah.
the select. And that's amazing amount of volume, though. It's a 1,400. This was 1,100 even just a few weeks ago.
Yeah.
So that's great.
Trust me, I am like neurotic about this. It really brings me joy. It's sick to be able to watch everything because it's very transparent. I can see every single permit coming in now.
Yeah.
You don't have to try to look for anything, so I can click on it to make sure it's going to the department it needs to. Where before, we couldn't see that, so departments were kind of getting cut out of things that we shouldn't have been, so
Not
that's
anymore.
also.
Not anymore.
Nope. New sheriff in town now. On to the grants. So the immunization grant, we just did the RFP for. That's in this current year that we're actually operating in. So just to be clear, the RFP for the media campaign was not town money, it's grant money, because some questions came up about that. So I just want to be crystal clear again. That was CDC money and not town government money.
And you had to take it to get your public
To
health.
get my nerves, yes. And so that ended on Thursday. Greg and I reviewed all of them. We actually got 11 or 12, which I was shocked. I thought we'd only get like 2 or 3. So next week we have a bunch of Zooms set up to finalize that piece of the budget. We also received a workforce development grant that will go into effect July 1st. So again, it will keep my nurse going through the grants as it has been for the last 4 years. And that's in the amount of $45,030. And all the childhood vaccines, we are re-enrolled in CVP, the VFC and VFA programs. So those are received for free from the state.
I have a question. So the grant is going to give you 3 public health nurses through May 2024. Is that right?
Now, so I have one that does primarily all the hours, and then in the larger clinic times, like in October, the other 2 I can flex in, but they're not working the hours she's working, but it is all part of the approved budget with the state.
And then when the grant is done in May, is the idea that these people stop working for the town?
Well, this year, the immunization grant goes to June 30th, and then the workforce development grant kicks in for next fiscal year, which is what we're talking about for this budget year. And then I'm searching for grants for next budget year. So if we don't get that money, either, you know, we would have a discussion about general fund, or, you know, like a grant, they can just go away and all that programming go away. But in the meantime, I'm trying to get more grants to keep it going. But we do have one in place for the next fiscal year, which is what we're talking about now.
Okay. And what are they doing predominantly?
Well, they're doing, I'll get into that a little later, but mostly with vaccines, diabetes screenings every 2 weeks. We're doing a lot of public health educational seminars. It will get into in another slide.
Okay, thanks.
And another grant that we have is the Public Health Preparedness Grant. This is a 5-year budget cycle. We're in year 5 of the 5-year cycle. The new grant starts July 1. That's a small grant of only $11,708. And I hired Nick Jossam, part-time coordinator. It's only 4 hours a week. That's to help update the public health plans, because for public health preparedness, we have all these deliverables we have to do, tabletop exercises, full-scale exercises, all the, you know, the plans of mass dispensing and anthrax, pan flu, COVID, you know, you name it. And Nick, my coordinator, he's also the Region 1 Public Health Coordinator for all 14 towns. And he only gets 15 to 16 hours for the 14 towns. So he's able to do our 4 hours because it's not full-time position. And he has a master's of science degree in emergency management. And he also has a bachelor's of science degree in arson investigation with a minor in criminal justice. And Nick helped me a lot during COVID before I had the grant money to help me out to get the deliverables done when I didn't have anyone to assist me. So he's been a breath of fresh air for me. Let's see. Nick also wrote our volunteer Region 1 reception center plan. That is a plan that if there's, you know, a major event like a mass shooting or major disaster, of where you would have volunteers, you know, show up to screen them, give them assignments, etc. This came out of a discussion with Newtown Health Department and what they went through, and people were just self-deploying, you know, wanting to help, you know, EMS and good-natured people, but unfortunately, you have to have a way to manage that for obvious reasons. We began that with a tabletop exercise at the Bridgeport EOC in December. There's a full-scale exercise in March at Norwalk City Hall. I won't be able to be there because that's my town council meeting that night, but that's for all Region 1 CERT teams, MRC, social services, and public health officials. I've already sent it to Stuart Salvini, so New Canaan CERT can go to that as well. And we're also holding on April 24th, a trauma response training with the Fairfield County Trauma Response Team. Our own Bonnie Romilly, who used to be an EMS captain, started this group. So that's going to be held at Fairfield University for all local health, hospitals, EMS, and all our other ESFA partners. ESFA is essential function 8. So that includes local health, hospitals, EMS, nursing homes, dialysis centers, behavioral health, basically everything in the health, you know, realm. These are the CDC 15 capabilities for public health. That's a map of Region 1 of the 14 towns that are included. The lead changes continue as we discussed last year. The new standard of 5 micrograms per deciliter for full-scale inspection and investigation went into effect on January 2024. The new standard of the 3.5 micrograms per deciliter requiring follow-up on cases went into effect on January 23rd. And by state law now, they have to be, the children have to be screened every year until they turn 6. So
have we had many children above that new level?
The new level, not really. We've only had about 11 because in New Canaan, despite there still being a significant older housing stock, there's also been a lot of demolition, a lot of renovation. So we're fortunate we're not getting crushed, obviously, like the cities are. So for us, it's still been manageable. And the fact that Shannon, one of my sanitarians, my health program planner, she just got her lead inspector certification too, so she can help me with the case management. Because lead cases take forever. They drag on forever. It takes about a year to get through the whole process of the testing, the abatement, the clearance, and you know, they're just very, very cumbersome.
And you're screening the kids in the school with blood tests?
No, the pediatricians do.
Oh, so the children have to go to a pediatrician in town to get for
anywhere. It's a
anywhere?
state statute that, and the pediatricians all know about it. So, I mean, usually it's on, you know, if they go for an annual, but the kid's well and the children, the parents don't take them to the doctor, then they'll just get screened at the next visit. But pediatricians are required to screen them yearly if they're in their office. Community health programming. Shannon and my nurse Ellen were certified by Fairfield Health Department for matter of balance training. This is one of the initiatives of the state health improvement plan, because falls are the leading cause of emergency room visits and account for more than 8 million emergency room visits every year. Ellen, the nurse, will go over all the medications that they take. Some medications do make you, you know, off balance. And then the training itself gets into, you know, training them on balance, almost like yoga kind of stuff. And those programs have been conducted at Lapham and Schoolhouse and anywhere else that's requested. We also did a free skin cancer screening in partnership with Connecticut dermatologist and Dr. El DeMol, who's a New Canaan resident and dermatologist. On October 23rd, we did that at Irwin. And that was also sold out. We're planning on doing another one in April 2024 at Schoolhouse Apartments. The booth down there is one of our vaccine booths that we doubled up. Shannon's dad is the chief building official in Greenwich. So he built it for us on the weekend. So people were able to get a full screening. We had 3 of those set up at Irwin, where we used to do the vaccines. QPR, like I mentioned before, it's been going on every single month. This month we have one at the library, and we're doing another one at the Y, and we're training all the staff at the Y. TikToks, we've done several of those with Dr. Jamie Ruskowski of Comprehensive Care. She's also a New Canaan resident, and she collaborates with Shannon and my nurse Ellen on conducting these at the Lapham and at the library. The library has been great about giving us space and sending out our information through their listservs, because we don't really have any email listserv. We do have our social media Facebook page, but it's been great to get these out, and Lapham sends them out through them. Friday mornings, my nurse Ellen and Shannon have been doing a variety of health topic talks every week, ranging from hydration, respiratory diseases, over-the-counter medications, environmental health, heart health. We're in the midst of Heart Health Month, so we collaborated with the Y, and Y is paying for the media campaign for that. We don't have the funding for that on what we're doing, what they're doing, and sending out the mailers. The hydration talk we did at Lapham on January 12th, Staying Put sponsored the luncheon part of it, which was great. The diabetes blood sugar screenings we do every 2 weeks at Lapham. We also do the A1C test. That shows you the 3-month look back. That's, you know, only 10 minutes of a rapid test. We also do the screenings monthly at the Schoolhouse Apartments with my nurse Shannon and Ellen. There's a Heart Healthy event they're doing next week at the Schoolhouse Apartments on February 14th. We have a childhood allergen seminar coming up with Dr. Ruskowski of Comprehensive Care on March 8th at the library. That was requested by parents, even before what happened 2 weeks ago with that woman in her 20s that, you know, sadly passed away from a mistake at Stu Leonard's. And the FDA food code has updated changes about allergen signage needed in restaurants and stuff. So we try to do topics that are requested, and, you know.
Would those be Zoom or just in person?
See, the problem is the library doesn't really have, you know, that option, because that's what we wanted to do. We want to be able to record it. And we're just still trying to figure out the best way to do.
They did it on YouTube for the Jet Spec.
That's a good idea, because if these are during the week especially, it's
Right.
tough for people.
Because, you know, we would love to have that and have all the links
Yeah.
on the
YouTube's the
website.
right answer. Yeah.
Yeah, that's what they did with that. You should talk to them about that.
Yeah, I'll definitely talk to them about that. And then we're planning a mental health educational talk besides the QPR in May with Kimberly Morgan, another New Canaan resident, board certified APRN from Fairfield Psychiatry. She specializes in adult psychiatry from 18 to 65, working on finalizing the date, and I'll be either at the library or at Grace Farms. And then we also did the 25 free radon test kits dispersed to homes. Flu vaccines, we did 765 to date. Again, order those through the state. We're also still doing the homebound,
What, year to date, 700 or?
765.
Since
from
Jan 1?
No, just
Oh.
from October.
Yeah, I was gonna say. My goodness.
No. And then we're still doing the homebound, which has been extremely receptive. It's not just those that are bedridden, those that, you know, have sensory issues or can't, you know, go somewhere. Ellen does that by herself, so that's been very well received. And then we also do it for EMS, the Lapham, Town Hall, Waveney, wherever. Inspection data. That's our data. I did a year to date estimated. The temporary events for next year, I lowered the estimated just because, you know, we're not really sure. And talking with B at Waveney about, you know, what's going on with weddings and timing of elevators or whatever. Doesn't really change much with our, you know, revenue because we increased the revenue of the restaurants, which is the same line item. So it will still pretty much be the same. And it's mostly the outdoor events that we get the bang for the buck. And then the salons, pools, and septic and garbage trucks, like I mentioned earlier, is in May and June. That's why those don't have anything yet. Now to, you know, what you guys really care about is money. So at the top, my three full-time staff are town hall union. They get a 2.75% union increase this year and next. The 401 was also a 1% town hall union contracted addition. At the bottom, we kind of renamed some things, but we're actually in a less than at the bottom. Bluebeam is what we use to scale the plans that come electronically. So to offset that, we removed over 1,030 from office supplies, because now that we're not sending out the mailers, we're not paying for all that stuff, it offset, you know, that cost. The one thing that I do want to mention that's not on here is the gas oil. I did reach out to Danny at Highway, because obviously we didn't have a car, we're using personal cars. Now, one of our cars is electric. So the only other car that we have, the SUV, I did speak to Danny. He said it's roughly $25 a month. Right now, we've only used like $32 for the current fiscal year. So I'd be fine if you wanted to lower that down to, you know, 300. It's only $275, but I know every nickel counts in this budget. But that's just why that's what it is. And for travel is only for reimbursement going to trainings, but the town policy is you have to reduce your mileage from home. So because Gino and I live so far away, by the time we reduce the mileage, it's not worth the hassle.
You owe the town money.
$10. So that's what that is. It's not that we actually travel anywhere. So really only Shannon gets to use that for reimbursement. She lives, you know, only in Norwalk. So, and like professional memberships, you know, that's what we discussed last year, the QPR books, the medical supplies, all that, you know, jazz, so to speak. Any questions on any?
Well, as always, first of all, I'm exhausted listening to everything you covered in the last 20 minutes. Oh my goodness gracious. Do you have what you need?
Yeah.
Does this get the job done? This is the question for you.
Yeah.
I mean, okay.
You know, I wouldn't lie to you, Todd.
I know. I ask you every year and you always give me an honest answer. It's, you know, so thank you for that. And
then revenue. So we did last year when we did the fee memos, we increased fees for septic and restaurants. That went into effect. We had to post it for the whole month of May. It went into effect July 1. I intentionally didn't raise the plan review line item because that's the building permits and the pools, because that's, I want to see in OpenGov the real change, because there's a set number of restaurants, there's a set number of salons, so that stuff doesn't really change. But what I'm already seeing in only the 3 months of OpenGov, it's around a 30% increase for my stuff. So I don't want to touch it in this year until I get the full year. And then next year I'll have the real picture in November of what that line item should increase to.
I wonder if some of that's people, it's so easy to do, so much easier. Maybe people just are
Well, and
doing it faster. That's why you're seeing.
well, like I mentioned last year, the biggest problem was we had no control over our money. And the building department didn't collect the fees up front. So people would submit an application, it'd go through all of us. I'd have my spreadsheet saying I'm supposed to have X money. And then some people never picked them up. And so that money was never collected. Now you're not getting anything until that money's paid for. So the money's right there up front, whether you end up doing that project or not, because time is money, we still have to review it. So it's been a huge difference for me on mine. I'm not speaking for any other department, but for me, of what I've seen, it's been huge.
So just reacting to that, I would say do what you're doing. You'll have a year's worth of data, as you said. It's okay to overachieve on revenues.
Yeah.
But so that's okay. And it's not going to be such a huge number, but we'll just track it. And if we have a positive variance, we have a positive variance. I think that's smart just to do it the way you've done it. So I'm for the sake of what's going to be maybe, a little more $50,000, $100,000 more.
Right. I'd rather overachieve.
Yeah, that's right.
We look like all stars.
Exactly.
How do we set?
Do anyway.
I'm just curious, how do we set our pricing for the permits? Is it sort of a cost plus or is it?
Well, for health department, again, I'm only
And-
speaking for me.
Yeah.
When I do the fee memo, like I did last January, I go on every department in the area's website, pull all their fees, and I create tables that I present to the Board of Selectmen of every town's fees, what the average is, because we never want to be the highest, we never want to be, obviously, the lowest. And then what I recommend, and then the Board of Selectmen could either go up or down from there. So that way I'm not just saying, well, this town does this. No, the numbers are right there for them. So we try to do that. That's a yearly exercise that they ask for.
And you mentioned that they went up last year.
Yeah,
Good
so
answer.
because
It's a good answer.
this went into effect July 1.
But we don't want.
So this year was, okay, now we don't,
Break, right.
yeah, especially since, everybody's kind of feeling inflation right now.
Yeah.
Nobody's immune to it, well, in some, but
Yeah.
not many. So that's it, and I'm on time.
Perfect.
Tucker, you proud of me?
Question, anybody, any other questions? I know we've got Victor and Michael online behind you, which is sort of kind of freaky to have,
No, I have
Any
no
questions?
No, great job, Jen.
Thanks.
Victor's good. Anybody here?
Nope. Yeah, no, I'm here and I don't have any questions.
Great. Thanks, Victor.
So just a big thank you.
Yeah, just a huge
Yeah,
thank you.
thanks.
Jeez, it's a
lot of
lot of work.
services.
It's a lot of services. Thank you so much, Jen.
Thank you, guys.
Okay.
So, stop sharing.
Yeah, we'll have, I think, Penny, you're going to come up with Bethany? Because no sitting behind the TV. We don't really know what to do.
No.
I'm trouble finding the files, or is it in the? In the code. It's going through it.
Thank you.
Right.
Oh,
Steps
it's
in.
email something in there. Oh, okay.
Welcome.
You need to find.
How are you?
Yeah.
Good.
In the cloud, comes to cloud. And.
We're on to human services for
Yep.
people on. Yep.
Bethany Zaro, Director of Human Services, the town of New Canaan.
You'll find this. That should be folded. They must not have uploaded you that amazing.
Right, can everybody hear me? You turn off the video.
Right.
Down the bottom left, Bethany, so next to your microphone,
Just
just
stop
stop video.
Left.
I might have to do it. Where? There you go. Oh, no, someone else just did. Hold on.
Okay.
Got full screen, let me escape.
No, she's still up. You stopped somebody else.
Bob's computer went down.
Claire.
Like we start. Double click.
IT Director, Tucker Murphy.
Thank you. Zoom queen. All right, so Town of New Canaan, Human Services Department. I'm here tonight to present the budget request that has been proposed by the commission and requested and gone through a couple of changes, and so that will be near the end. I do want to start with the mission statement for the department. It's to help all New Canaan residents function optimally by developing programs and activities that address developmental needs, as well as by helping residents obtain appropriate social services and resources. So I wanted to break this down in terms of the two main mission statements. We've got helping residents obtain appropriate social services and resources. This I consider the individual assistance aspect. And then we have the second mission statement, and that's developing programs and activities that do address the needs of the town, individually as well as the community. So done through community outreach and education. And the individual assistance, we can trickle down to state and federal programs, as well as town human services and agency, area agency grants that we provide to assist the individual, as well as we do partner with local nonprofits in order to achieve the community outreach, education, as well as the individual assistance. Just to give you a bird's eye view in terms of numbers, since this is finance, we have about 20,000 population, and human services clients and contacts about 1,150. And that includes the programs, the local agencies that we work with, and the state and federal programs. This is the assistance that we're giving the clients and referring them to. And then you can see the breakdown age group wise of the 1,150. So our case management trends, these are case trends. This is not referrals, and these are people coming in, doing a financial assistance, needing help with something, and we continue the relationship. It's not just a one-time phone call. It's a yearly financial assessment where they have to qualify for the programs that we do offer. So you can see, from fiscal year 2022 up to 2024, you can see the trend. There has been an uptick. State constant is more about the domestic violence cases. Those cases are through the police department. They are not received any other way. So there is a lot of DVC cases coming through, referrals going out privately to other agencies that are in the area, and the resident would like to remain private. So we do not hear about that. Seasonal programs, the energy assistance is going up from 38 to 76 people, as well as the renters rebate program, 61 to 74 people. That they have to go through us for that, and it is for those 60 years old and or disabled. So the trend is up.
Is that apples to apples? I mean, you had fiscal year and then you had just to 12/31. So it's only
year
half
to
year.
date. Oh, so the
So
year
they're comparable.
right now is year to date, so
Right.
you can see.
But that would mean that we have a whole nother half year to go, and we were
Correct.
so we would be at 404 if we doubled that versus 184. Am I looking at that right?
180. Oh, for fiscal year 2023.
Yeah.
Okay, that's 184. But as of this date, we have 202. No, I mean, we seem to creep up every, 2 to 5 residents are coming in every month. Yeah. This is the total value, and right now we have 202.
But
I think said another way, is the fiscal year, just go to all the way to the right, 2022.
Yes.
That was July to June.
Yes, July 1st to July. Yeah, June.
And then same thing for 2023, July to June was 184.
Right, and now right now, we're only halfway through the fiscal
already-
year.
That's his
Okay,
question.
so we're basically running overdone. That's what I was trying to.
Yeah.
'Cause now you're gonna end up with
Yeah.
any course.
I mean, who knows,
gonna
right,
double that.
right,
It's,
but,
it's number of clients they serve, so.
oh, I got it.
Okay.
I got it,
They
right,
serve,
okay,
so it's not-
understood. So yep,
We don't start at zero
Yep.
every June
Okay.
1st. These are added,
okay.
some are taken off,
That's
Right.
from,
they move out of town.
okay,
Yeah, so
Okay.
this is what, with attrition
Yep.
and add additions.
That's-
Just one question though, on the prior slide, you don't have to go back, just a quick question. It says we served client human services client / context, 1,147. I think that's this past year, or what's the date of that? That was this year or 2022?
So this is, yes, this is, the 2022 data is just for the total population.
Oh, right, okay.
Okay, and then our data for fiscal year, currently, this is what we
We
have.
had 1,147. Okay, and then so the question would be, how's that trending? Is it about the same every year? About a little over 1,100 people?
No, so what we do is we've changed programs too. The year before, we've always had the flu clinics and things like that. That is now over Health and Human Health Department.
Right.
So we've lost, but we've also gained in terms of
Other
programming.
programs. That's right. Okay,
Yeah,
that's
very inconsistent. It's not apples to apples.
Okay.
So in terms of the state and federal programs and agencies that we work with, the social workers, we have 2 social workers. One is a youth family social worker, dealing mainly with the schools and any adult that has a child that is in the school system or is of school age. Any child that has graduated and out, we take that is considered an adult. Caseworker Marcella Rand is social worker. She deals with the senior and the adult population. So there's different resources you need at those different ages. So that's why it's easy to separate and to stay in touch with what's available for those age groups. So we have social services, social security. You can see all the state and federal programs. Adult protective services has increased in terms of our involvement through the year, for the past few years. And because of our adult senior caseworker has really gotten hands-on with the caseworkers at the state level, which is great. The Department of Children and Families that Jackie works with. And so these are the agencies that we can go to at the state level. Let's see what's happened here. Okay, so systems by age group. This is 2022 Connecticut Department of Social Services. They do not have 2023 out yet. And you can see in terms of, this is state assistance by age group. And you can see the trend. It's obviously increased over the past 10 years. The majority ages are between 18 and 64 years old, with 1,236 recipients. They qualify, they have to do a DSS application, and broken down. And this is a bird's eye view. This is in terms of what the clients tell us when they fill out their financial assessment. This is the DSS clients, 0 to 17, 517 are showing up at the state level. We have 217 that we service. They come in terms of not financially service all the time, but we help them fill out the applications. They need resources. We give them resources, or they are involved in a food pantry or other programs that helps basically the children level. So it gives you about 42%. So you can see through the age group, our lowest age is 65 and above, 150 clients that we service. It's about half of what DSS is receiving. So medical benefits, just wanted to give you an idea. Once again, as well, all the types of assistance from the state, cash, food, medical, and other, and the medical benefits. This is unduplicated. So meaning that it's not, sometimes people do qualify for Medicaid and Medicare. This is unduplicated participation. So we have a couple thousand people receiving, qualifying for medical assistance, and that all the way up from birth to seniors, depending on what their qualifications are. And once again, I broke this down in terms of our clients at the town level. From what we can see, from our perspective, this is who we are servicing. And SNAP, the food stamps is our biggest, where 300 people are DSS clients receiving the food stamps. And it appears that we are, on an average, we have 150 of those people that are also receiving. We're bridging a gap between the SNAP, the income that they have coming in, and then that bridging that gap. That's where Human Services comes in with the food pantry. So the food pantry, this is a key indicator for us, which we see an increase in everything. But the most important thing is, if you notice in 2022, January, we had 90 households that we were feeding, 90 household individuals that we were feeding, and now we have 220. That equates to, we got 96 shoppers. That means 96 households are coming in, feeding 220 people, compared to, in 2022, 39 households with 90 individuals being fed. So as I've said before, what's driving this? The landscape is more affordable housing and low-income housing that's being completed, as well as the economic environment, and also the COVID ARPA funds and the food SNAP, things like that. All the assistance that the state was paying, that has all ended, and now they're coming forward, and there's a greater need on the community level to maintain their the food. What we also do with the food pantry, we also offer items that are not covered in SNAP, like diapers, laundry detergent, toothbrush, toothpaste, things like that. We try to offset, and so they can buy protein and things at the grocery store, which is all gone up. So now, besides, that's the client services. Now the programs that we have, you can see they're endless, and whatever needed, we definitely will see if there's a response. We try programs, and if there is a response, we continue them. But these are really the mainstay of the programs that we've had year after year, and they continue to increase in terms of community involvement, in terms of donations, volunteering, as well as definitely participating for the needs. Any questions in terms of what a program is? Happy to discuss. So the community partnering and education that we do, that aspect of the mission statement, this is the library of agencies are endless. But these are our more common ones that we work with based on the needs of the individual coming in. And we've formed through the past few years, great partnering, great networking, great relationships, and easy access to the needs of the community, of the individual, should they need something. So I wanted to give you this partnering and assisting fluid chart. It's just all a combination. There's no wrong door. Every door can be a right door, and it's everybody participating from up at the state, federal level, I don't want to say down, but over to the individual, human services, and the community reaching out. So here we go with the requested budget for fiscal year 2025. Really looking up at the top part, human services expenditures. Our staffing is complete. We've gone down in cost in terms of overtime. We went down 1,000 for that. And we went down 2,500. Public health services, that includes evictions. Our evictions have gone down after the COVID renters and landlords, not having to pay the landlord and things like that. That has settled down. So this town is responsible for moving the items out of the property that has been left after the person has been evicted. This is a state mandate. We have no choice, and the cost goes to Human Services in terms of the moving and the storage. So our next part is the Human Services agencies. This is where we have formed rapports through the year, a rapport through the years of the commission. This is all an act of filling out the mission statement, connecting with it on all the levels. And this is what's happened through the years. I wanted to give you a historical view starting in 2010. This is something we have always done. After COVID, when we saw that we were having a lot more input by outside area agencies for financial assistance, the commission said, are there other agencies that we need that are helping us? So we did include last year a few more. This year, just with the environment and the atmosphere of what we're dealing with, department-wise, we have gone down in what our budget we're requesting for the services. This is where the Board of Selectmen have come in with a new administration and a new landscape. And so we're working with everybody in terms of meeting the needs and the goals of the town, as well as keeping a community of wellness starts with individual wellness. So we're rebalancing. It's a rebalancing time right now.
I'm not sure I'm following the prior page. Can we go back?
Yep.
I want to make sure I understand. Refresh my memory. Why did the increase in salaries? What was the revised change? You added somebody?
For salaries?
Last year. So we went from the adopted budget of 401 salaries and we end up revising it. This is this year's budget to 416. I just can't remember why. We went up.
Where are you seeing that?
So the 24 adopted in the middle.
Yeah.
Salaries 401, 791. Top one.
So go over
First
two,
line.
two columns.
Back-
Go over to the left.
Go left.
Okay. And now the revised?
So then we added 15,000 to it. And I can't remember. We added it during the process because we changed it. Must have voted on it.
Yeah.
I can't remember why.
That I can't answer. That might be HR question in terms, because we have kept.
Wasn't that the allocation of ENZA through the different departments, Bethany?
It goes from
her revised 2024 budget went up 15,000 last year, and we're trying to remember why.
And that's unknown. I know she was working at other departments.
Right, we split her time.
Well, the revised would have gone up from non-union COLA being added onto it.
So this was done at the HR level, and I'm unaware.
I can't remember. Anyway, you're really increasing it from that 4,000. Just to be clear, I know it says 19, but that's budget to budget. But we made a revision, and the increase is only 4,000, really, right? Am I right?
Yes.
Okay.
Yeah, I see. Yeah.
All right. So then, everything else? Let's just make sure I'm trying to understand line item to line item. And Penny, did you have something you wanted to add? Do you want to do that here, or I'll leave it up to you two? I don't know what your cadence was, so I
can do it now.
It's up to you and Bethany.
Outside agencies, and I want to thank you for the opportunity to address you, and I want to compliment the relationship of the Board of Finance and the Town Council subcommittees as we discuss our various departments, and it gives us an opportunity to really discuss in detail and evaluate from our respective perspectives, you being financial and the Town Council being more, how we represent the folks in town who have elected us. The timing's a bit tricky tonight because the subcommittee for Health and Human Services is meeting tomorrow morning. So I'm just here to give you a preview of what the subcommittee's discussion is going to be tomorrow, and to stage our serious concern about the proposed cuts to the Health and Human Services outside agencies' budgets. As with every new administration, there are different ways of carrying on business of the government. And with genuine respect, we welcome these new approaches, as there's always room for healthy improvements. And as a veteran councilwoman, I'm fully aware of the pressures on the budget, purportedly greater this year than in the past years. But I must emphasize the critical importance for us to not lose sight of the mission of the various town functions, and tonight, Health and Human Services. The Health and Human Services Commission is populated by individuals who have broad and deep backgrounds in the field of human services. They are charged with understanding citizen needs in the areas of shelter, food, safety, and health services, be it mental or physical health. Meeting their goals, they have recommended focus areas for the health and service staff. And so this year in their budget, labeled or identified various supports for the outside agencies. It is these organizations who deliver services directly to our citizenry and address their multiple needs, quote unquote. As they interface with the Health and Human Services staff, they help create a complete picture of the client's needs. And it's this interrelationship which is so critical to enable the staff to deliver a level of service that is expected in the community. So I'm here to encourage you to respect the budget recommendations that were made by the commission. They were stunned by the cuts, and I have to admit, after many years of intimate relationship with the department and very familiar with the fine services they provide our citizens, so was I. If indeed there is a new public policy direction in delivery of support services to our citizens, so be it. But that new direction, I posit, needs to evolve from an in-depth research and analysis by the commission, the staff, the administration, and all of us involved. Funding is but one consideration. Public policy is another critical one to consider. And so we need to evaluate our priorities in support and not to be flippant. And John Howe knows this. What is the foundation of providing human services, say, when you compare it to wood chips on the trails at Waveney Park? We need to take some time to work together to consider the human aspect of our policies and action, and what it requires to support our most needy at a level that reflects our humanness. Fund these support agencies as recommended by the knowledgeable commission and staff, and let a complete evaluation take place over the next month and year. And Health and Human Services welcomes this and is actually engaged in this challenge. So let's determine what the respective roles of state funding, which sitting on the State Commission of Women, Children, and Seniors, I've experienced is woefully inadequate. The role of our local tax dollars, perhaps none. Of the philanthropic community, perhaps more, as well as personal responsibility, perhaps even more. This will take some time and an important exercise to permit ourselves so that we know we are serving our community appropriately and well. So I and the commission and the staff look forward to this committed analysis. And we invite you to join us in this analysis and share our concern going forward as we develop perhaps a new public policy.
Thank you for that. So maybe I misunderstood. Are you saying you're meeting tomorrow to go through this with the subcommittee?
Yes.
So we're not voting on anything tonight. Do you want to come back? Is that you want to have that meeting, go through a prioritization? I mean, it looks like there's a reduction of $44,000. So that is the question on the table. I'm guessing is what you want to address.
I think there was also an original budget that was presented by the commission through the staff that was adjusted. And I think my concern is, are we changing our public policy as to how we address the needs of our community? And what is the role of the commission in making recommendations for how the departments move forward? I questioning the wisdom of the commission, whose charge it is to present those recommendations to the staff. And so if we're going to be adjusting what the role of the commission is and the relationship to staff and all of us, I think it's a bigger question to be addressing than has been given the opportunity.
Yeah, that's not our swim lane. I mean, I think, I'm not sure that's what you're asking us to do. We're not questioning anything. We're just finance guys. We see the number here. So if you want to meet tomorrow, you're saying you do a bottoms up look and you came up with a number and it's not this number. You want to come back at a subsequent meeting after you meet tomorrow and go through? I think you need to get some answers to those questions we can't give you, but I think they're good ones. Is that fair?
I've met with enough of the members of the commission that are sitting behind you here, behind me here, to know that there is some concern about the cutting of recommended funding prior to having any discussion about what the policy is and how we address the needs of our community.
So I think I probably should jump in here because it's a result of initial budget talks before it even came to the budget, to the Board of Selectmen. And there was a significant jump year over year. And if you look at your historical starting in 2023, significant additions of additional health and human service agencies that the town started to support in small ways. And it was a fundamental discussion that I had with Bethany and the commission, not the town council people, but the Health and Human Services Commission, who are not here tonight, and talked about, what is the role of municipal government versus, New Canaan Community Foundation and all kinds of private giving at these kind of levels. And so it was my ask that they look so that where they took the money was the commission's job. But I talked to the commissioners of the Health and Human, and I said, I would like to see this more flat. And they took money from where they thought was appropriate, based on a dollar figure because I'm not equipped to look at those agencies, but they are, because they work with those agencies, and they took the dollars. I gave them direction on a policy way I wanted to look at things. So that, I just wanted to clarify that because I don't think that was clear in Penny's remarks.
I also want to make, in terms of the budget itself, the New Canaan Urgent Assessment Program, that $50,000, that was placed in our department. So when you say, wow, it's gone up 50,000, that was something that, the town has decided. They made it the 1-year commitment and they put it in human services. So just to let everybody know, we haven't crept up in terms of numbers of that. That is a program that was put into effect through ARPA funds. It was decided at this point it's going to remain for this fiscal year. And so it was put into ours. So that is that 50,000 increase right there.
And I think you also mentioned, and this is for later, but we probably can reduce that 50 to 25. So
right. So another idea with the opioid settlement fund, that's we received what, 80,000. Yeah, $80,000. Looking at the remediation uses, there are about 17 pages that you can apply this settlement money towards. And the urgent assessment program definitely qualifies from very many aspects, 18 actually of the 18 pages. So what we can do in terms of, we have already approved 25,000 of that. We could take that 25,000 and put it towards the 50,000 without having to pull 50,000.
That makes sense.
And maybe even put it 25,000 somewhere else.
Put it
I
to
don't
the-
know. But I'm just trying to play with the numbers, respecting the request and listening to the commission, just putting everything together, working with everybody.
So just a suggestion then, I think come back, I think it makes sense. There's a couple of moving pieces still for you. I more than if come back with the 25,000, however you want to put that back, what you just went through in terms of what you think makes some sense, and we'll look at this again. Tucker, maybe the last meeting
7.
on the 27th, no, the 7th?
27.
Yeah, 27th, yeah. I think that makes sense. I mean, I think there's just, you still have some moving pieces. We don't want to lock in a number today with that, with what we just heard from you. Is that, if that's fair? Yeah.
Absolutely.
So Bethany, this fiscal year 24 is just through December 31st, I assume, right? So that's half a year.
Exactly. Yeah.
You were at 169 without the 50 back in 23, not that long ago. And the 201 would be 19% increase. So, but that would include the 50. Okay.
Yeah, but some of these, like Meals on Wheels going down 50%, or domestic violence crisis going down by 75%. Those seem very extreme cuts.
Extreme cuts. What I've done is I've looked at the usage of these agencies for fiscal year 23. You know, if you have any questions in terms of domestic violence, crisis center, this is who used 66 victims. This is all New Canaan based, came to DVCC. There were 560 referrals and information, phone calls from New Canaan residents. There were 47 interventions that were done either with an employer, a creditor, a landlord, or from an academic institution. There were 257 crisis interventions from New Canaan and 122 counseling sessions from New Canaan residents. It's huge. So
but the thing you have to think about, just as the other side of the coin, is that we are the only community that does this in this way. The state, I reached out to a few other selectmen in other communities because I said, well, is this what you guys do? Because I look at these dollar numbers and say that's more private giving levels, not municipal levels. And so they said, no, you don't, that's not how those agencies work. The state refers them and they want us as clients because those agencies get funded by the state based on our referrals. So they don't need our, the state gives them money for our clients from New Canaan.
Right, but to add more information to that, what we do is those grants are for the individual person that they're getting paid. This is for general operating costs that they do not get from the state. So we do, Catholic Charities or Community Action Agency of Western Connecticut, their counselor comes down, their social worker. We can't help pay a security deposit for someone, but they can. So if we can pay the first month's rent, they can pay the security deposit for a divorced mother that's had to move out of her house and keeping her kids in school. There's so many individual situations, but just to let you know, this general operating purposes is really distinct from the federal money that's coming into these agencies, just to get to get that broad picture.
Just a question, Meals on Wheels, how does that interact with the food pantry? Is that?
So what we do have, Meals on Wheels, they service 45 to 55 New Canaan clients. And that could be from 1 day a week, which equals 2 meals and a snack, or it could be 5 days a week. It could be short-term, they're convalescing from a surgery, or it could be long-term, just homebound and incapable. So
the pantry is people go to the pantry.
They go to the pantry. We
visit.
do have some homebound individuals that we do deliver to. They're not capable to get in the get about. You need to have an aide with you. They do not have an aide. They're trying to age in place, remain in place. So the Meals on Wheels gives them a balanced diet. The food pantry bridges that gap. It gives them the toothbrush, the toothpaste, the laundry detergent, things like that. as well as.
And that's at St. Mark's, the food pantry.
So yes, we run.
But I don't see St. Mark's anywhere. Is that just that they provide their space and the town
rent the
provides?
space from
Okay.
St. Mark's, the town, Human Services.
We're talking about $2,500 in a $179 million budget.
Or another way to look at it is to keep it flat, it's 20, because 25 is going to come back with what you talked about. So for $20,000 it gives you the exact same amount of money you had last year. It's de minimis to your point.
Yeah,
I think.
it is.
One of the problems is though that these state and federal programs come and then they go away and then we're on the hook. So you have to, obviously this is a
perfect
tough
example
example.
of Medicaid dropping some of their Medicare savings programs. You know, we have about 115 people that are on the Medicare savings program in New Canaan. They always talk about dropping that. That would be devastating for a lot of people on a fixed income.
So can we do that? Can we have you come back? We'll put those thoughts back together. You just picked up the 25, we think, and then figure out the rest of it and come back and propose what you're asking. Right? This is what you're asking right now is 2,500 for domestic crisis. That's what the number is. So
That's what's currently there.
just saying, if that's your proposal to us, if you want to rethink that number, you need to come back with another number.
I think what
We're
you're
not
saying
making up the
is-
number.
Same number for the last 12 years.
Commission, right? I mean,
I guess how would these, with these cuts, can these programs still operate with state? I mean, is there like a lapse where you've got to apply for state funding, or that you've got to, so are some of the residents not going to get these services for a period of time, or how does that work?
Good question. It depends on the amount of money they're getting, federal dollars, and how much they can give. What, 2,500, I doubt it's, it's not going to make or break anybody, but it is our way of working with helping with the operating costs, because it benefits the community. It benefits us in terms of the resident itself. And it's very easy access to work with these people. And it gets them to New Canaan. As I said before, it is the traveling. Someone's not going to, it's very difficult for many people to go to Stamford or Norwalk or Danbury. They come down here. It's our way. The commission at one point said, what can we do? How can we help? We want to do more. This was one way. And if this is not going to be the way, we will find other ways. But there is going to have to be some aspect when I see, like the kids in crisis, Teen Talk counselor. The fact is we have one for next year for the high school. The funding for the middle school Teen Talk counselor, if it goes through, we're going to have to do some private funding and scrambling and working with the great partnerships that we have already in place, and to see if there is a value in it still, and if it's something that's going to continue.
Is that in here for SACS that you're saying?
Well, it started out, the original commission's budget had half, it was 96,000 for the high school.
Right.
And then it was going to be half of the middle school Teen Talk counselor. This was just an ARPA funding Teen Talk counselor to see how it did. We're getting feedback positive from some places, others different feedback. And so it's just a time of discovery period to see if this is something that's viable after the ARPA funds are gone now. Do we want it?
So I would just, you've got to do all that. You've got to think that through for us and come back with, in the 27th with, you want to take this one up, this one, whatever it is that you'd like to do. Obviously, we're extremely supportive, but I don't think you want us to approve this number.
And I think the Board of Selectmen asked
right
at the Selectmen's budget, it's specifically on the Teen Talk counselor, because there's very little data. And so,
But it's not in here.
It's not, no, we took it out.
Yeah,
but
I
understand.
I understand.
There
was a reason. I understand.
So I think it's that greater discussion that really has me concerned that it hasn't taken place with the degree that it needs to take place, either justifying, the expense or bringing additional data. I mean, for instance, Wilton's transportation program is funded $170,000. I mean, that's a lot of support for their transportation. And then for us to cut our transportation system, not that we have to do what other towns do ever, but I think we need to be looking at how other people address their needs and their issues, and come up with our own pattern. And I didn't think that we perhaps had a serious enough conversation with all of us input to have arranged it.
Okay.
Other policy. And if we're going to change it, then we need to know that prior to coming in with budget proposals.
I think what you're hearing from us is come back, because we'd rather have it with what you want to propose. I think we're talking about $20,000.
Possibly.
So
Because
it could almost.
They were other.
Okay. Well, I'm just. You know where we pretty much stand on this. This isn't where we cut $20,000. Yeah. Right. Yeah. Okay.
Yeah, I just wanted, to wrap it up. This gives you an idea of where the money, if it goes right now, this is percentages, primarily kids in crisis.
I do have a question too.
Yeah, sure.
So kids in crisis, I mean, as I recall, they were also, I mean, it's the Teen Talk, but they were also the ones that provide that weekend hotline. Is that true?
They're 24/7, and they do have a crisis center where a child can go if they feel they're in danger or if they're an unstable household, something like that. So they do offer, and that's during the summer. There's a lot more in terms of just the Teen Talk counselor that $96,000 covers.
This is still the high school. So what we had,
high school stays.
the high school stays.
Yeah, yeah.
So what was grant funded during COVID, and now the grant has gone away, is going away. And there was no one there for last year, but there were some issues with the SACS program. And so I think the value at the SACS program is being questioned.
And I guess because we were talking about the Board of Ed budget before, and we have to consider that they were talking about bringing in an extra social worker, so I think there's all these layers that you have to, I think we just have to be more comprehensive in the way not us, but you guys, in the way we're looking at this, because there's obviously, we've got the health assessment program as well. So there's all these different layers coming at it from different directions. And I think you just want to be as effective as possible and deploy the dollars where they make the most sense.
And that was the conversation I had with the Health and Human Services Commission, is that there's lots of dribs and drabs going everywhere. And as somebody who looks at things more strategically, I think we need a real return on investment and funding organizations that we think are strategic for our needs. And then the other ones, they're still there. It's just because it just grows. It doesn't, and if you're not being strategic and you're keeping things floating because they're not really doing what you hope they're doing for the community. I would like to be more strategic in how we fund our health and human services.
And I think Marie raises a great point.
Yeah.
And do it. You can't do it in a vacuum or in a silo. You've got to do it in concert with the school, which is already spending money on literally the same thing. So okay. So I think you've got to come back with the reprioritize list, reshuffled, how you want to have it. Think about it. And then you'll have your meeting and.
Sure. Appreciate it.
Can I just give you a quick update on the question I just reached? Cheryl was in contact with salaries. There was a salary study done on all this non-union workers, and one of your was changed in the salary survey.
Yeah,
so
I remember doing something like that. That's why. Exactly.
And then there's the thought of Emma, she runs the food pantry, or possibly having that funded. So there's still a couple of things.
Were we thinking about taking some of the food pantry? The food pantry was overfunded, or
to cover Enza.
To cover Enza. Okay, that was where that money was coming from. That was
Okay.
a discussion line.
Anything else you want to cover here on these?
Thank you for your time.
Yeah, of course.
Absolutely happy to answer
Thank you
any
for
questions.
everything everything you're doing with the town, all these programs. Thank you. Okay. On to the library. Okay. I understand.
Still have the dog at home waiting for you?
Greetings. Welcome.
dive right in, or?
Yeah.
Dive right in.
So I'm Robert Lowe. I'm the treasurer at the library. I've been the treasurer for a little bit over a year, and I've been on the board going into my 4th year. Just to give you some kind of the background of other voices you may hear, I think Bob Buckman, our chairman, is on the Zoom, so he may drop in. And then
he's on.
Just to point, Kim McNally's here. She is our new CEO. She is in week 2. So in future meetings, you're going to see her a lot more, but we think it was appropriate to spare her on this one. And then on my left,
welcome.
On my left is Cheryl and Ellen from the library. I think you've probably interacted with both of them.
I think we've met.
Nice to see you again.
Nice to see you.
But so we'll share the microphone. Cheryl's going to focus more kind of internal. She's the assistant director, and again, Ellen as the face of the library, many parts of most of the external. We want to be very efficient with your time. We have kind of the way we're thinking about this. There's about 25 slides. We had the pleasure of meeting with Tom and Chris about a week ago, and we got rid of about a half dozen slides, and we put about 10 in the appendix. But we added a few just in terms of the budget, in terms of the selectmen proposal. And so those are going to be new. You don't have them, and we want to make sure we have enough time there. So we're going to try to go fast through these materials, but hit the key points. And again, just the background of it, this is part update. You know, it's been a big year for the library, but it also is meant to be support on the rationale and the thinking for our 9.6% request for the increase in our budget. And then we are going to come back. We know the town of selectmen has proposed 7%, and so there's a comparison, but the basis was in the original presentation. So we'll hit both at the back.
Okay, you have a bridge for the 7 to 9?
Yes, we do.
Okay.
You don't, unfortunately, but we'll have it and we'll share it with you.
Right.
It's going to finalize today. Just to frame it on slide 2, and I'm assuming all of you have it, just the size of the library. Very quickly, 3.57324. Our fiscal year is June 30th. Our proposal was to 3.893 million. And again, just re-mentioning that's a 320,000 overall increase. Roughly 75% of the request from the town, 25% self-funded. So from a revenue perspective, that's a high level. On slide 3, the way we're going to frame this conversation is much more on the expenses. So we have 7 line items here. And in the first 5 we've numbered, those 5 categories, which we'll walk you through in the presentation, represent 92% of our uptick in terms of the growth and the increase and the rationale, where that money would go and why we're looking for it. But again, mapping to that 320,000 increase. So again, we'll walk you through these 5 items.
Okay.
We'll go back and forth.
And just one question to answer on some point on maybe not on the salaries as much as some of the other categories. The original story was some costs would go down with a more efficient building, so forth and so on. So we understand, is that not happening? Is it too soon to happen? All those kinds of things. So
I'll try to answer a little bit,
okay.
but
when we get
then as we get into the categories, I would say one item that I think we've been effective at is we've held the equivalent employees. And so when you'll see in the salaries, it's an increase. There's some movement in people, but generally that was one of the big items. In terms of energy, again, in terms of total use, we've been consistent, and that's with a bigger footprint, but the price of the energy has gone up on us. So we can talk a little bit. There's a little bit of apples and oranges because we're more of electric now and it was oil and electric before. But we'll try to be more specific as we get through each of the 5 categories.
That'd be great.
So first on salaries, it's 3.9% increase we're asking for. Salaries, as you'd expect, they're approximately 63% of our entire budget. So we dig into this one a little bit.
And so salaries is concurrent with our usage really, because people are coming in droves to the library, and our dedicated team is here receiving them, meeting their programs, borrowing books, meetings, reading, using computers, business center, reference and instruction, readers advisory. Since we opened in February 2023, and we're almost at our 1-year anniversary. We've had over 360,000 people through the door. Before COVID, we felt real busy at 800 people. That was a long, you know, a really busy day. Now, you know, a really ho-hum day is 1,300 people. Like, yeah, we can do that. A busy day looks like 1,700, something like that. So they're coming. You know, we expected a significant usage increase. I know that was discussed in the economic impact study that was done. We looked back at that, and the projection for that increase was about 40%, which is what they based against other libraries in the region that had new buildings. And we're seeing 70. We're at a 70% increase here, and it's not slowing down. We had projected like, okay, there would be a spike and then kind of a leveling.
Right.
I think the 70 is level. We are seeing the usage now that we saw when, you know, right after we opened. So it's wonderful, it's great, but it also adds up in wear on the building, and it's upkeep and on our team who staff the building 7 days a week, 64 hours a week. So the other new big thing is our new meeting spaces. So we have 7 study rooms, and then 2 conference rooms, and then our large auditorium and community room spaces. Since we opened, there have been 6,000 meetings that have nothing to do with the library. So the spaces are in constant use. Representative month of January, those 7 study rooms turned over 1,000 times. And the conference rooms and larger meeting spaces had 30 board and committee meetings for various community groups, nonprofit board meetings, on top of all of our additional programs. This is just the month of January. So
is it becoming the high school library? It looks very much like the high school library.
Those 3 to 6 hours are stopping. So those none of that happens without staff intervention. Also, our conference and big meeting rooms can turn over 2 to 3 times a day. And we share those with our own library programming. So a typical day means that we have to break down the 300-person program from the night before, close the partition between the rooms, empty the room completely for baby story time. Then after that's over, set it up for a nonprofit board meeting with tables in the afternoon, then turn that down, set 300 chairs back over again, and then, you know, do it again the next day. And that's mostly done by one person. And that's not really his job. It wasn't his job before. So it's taken a toll on the team. And then there's also all the booking time and coordinating effort.
I think 60 meetings a day. I don't know what was the projection for that. Do you even remember?
Well, we knew that we were going to be increasing our programming by probably 20 to 30%. And it's just, we're finding that the demand is extraordinary. And what we've got are really long wait lists for a lot of our, particularly our workshop programs. So people are really excited to be at the library learning. I just left a program with 150 people where we were talking about diamonds, and I was very sad to leave. The room was filled with prospective clients for diamonds.
There's a lot of diamonds in this budget. Now, hang on a minute. We're looking at. Wow, that's really amazing.
So slide 8, just to orient the picture, this is from a 2018 presentation that was made from the library. And at that point, part of the point was to narrow the gap of the salaries, that New Canaan, relative to some of the local towns, the entry and the salaries were a little bit lower. And that was in 2018. Ground has been made, but as you look to the next slide, we're closer, but we're still 4th on our list of 5 that we're showing here. And what we're showing is kind of an entry-level librarian where a lot of the initial hiring happens. And if we have it in a per hour in the middle of the column versus the annual salary, just because some libraries are open more or less than others. So try to have an apples to apples point there. Progress has been made in terms of bringing that salary, getting closer to the competition, but there is a part of this in terms of that 3.8, 3.9% increase of just catching up to other towns, because we think we do everything else relative, if not better than them. And the last point, this is the last slide on the salaries, but it's very intertwined with the programs. And so one point I want to make before you see the programs, it almost looks like what we spend for some of the other towns is not apples to apples. And a big part of that is what we expect and ask our librarians and our workers to do. they not only are librarians, but they run almost all the programs. As Cheryl mentioned, they do most of the setup and they do the cleaning. And you're going to see other programs. Part of it is the scale that we want to bring in the kitchen, the auditorium, and bigger programs that's going to require more people and more professional use there. But also, just as we're maintaining the programs, want to show they're doing a lot more arguably with us. And that's kind of the lead into the programs.
So programs are really the heart of where the growth lies in usership at the library. And our programming is a very important part of how we bring connection to our members and inspire lifelong learning in the community. It encompasses both hands-on learning for adults like painting or 3D printing in the Maker Lab, as well as instructional learning in language, Excel, and other technology. It also means really great author talks like our upcoming event in March with David Grann, who is the author of Pillars of the Flower Moon and The Wager, for which the registration is already full at 300 and there is already a growing, very large wait list. Since opening, we have hosted 450 programs for adults with 15,000 attendees, and that's about 50 programs a month. An increase in our program budget is necessary to meet the strong demand that we are seeing from our community, with extensive wait lists as a regular occurrence. When I had the privilege to interview Misty Copeland, we had 325 people in the room and a wait list of 900. A typical program, that is workshop in nature, we will have 3 to 4 times the number of people interested as we can currently accommodate. Increased funding will enable us to bring new authors, hold more classes, and increase access to learning for all. Unlike some of our peer libraries, our librarians are responsible for the majority of the instruction themselves, as Rob said. And we've done more with less than our peers for many, many years. So now with a new auditorium, including the community room and the teaching kitchen, the demand for great speakers and instructional learning is exploding. We want to leverage our staff with outside expertise to meet this growing demand. Increasing the adult program budget will bring us more in line with what our closest peer library, which of course is Darien, is doing. A critical element of the new library design was driven by the need to create more program space for children, which tripled our meeting room space for these activities. Simultaneous programming is now possible for a variety of age groups, and yet we are experiencing very long wait lists for some of our most popular children's classes because our budget has not kept pace with the strong demand. Since opening, we have held over 850 programs for children's, teens, and families with 27,000 attendees. I think we're on the next slide, which illustrates how modest the program budget for children's programming has been historically. Obviously, the amount of programming opportunities will lead to increase our ability to enhance supplies and bring in outside experts to offer specialized programs, such as our recently piloted and highly lauded programming to serve our special needs community. A doubling of our budget only pulls us up to under a third of Darien's children's programming budget. And finally, I just would like to provide some context as to why our program budget is so pivotal from a fundraising perspective. Our programs are a gateway to engagement with our community. It is a way for us to connect with and encourage people to consider the strong value proposition that the library represents in their lives. And by providing our excellent programs and services, we establish relationships and trust, laying the groundwork necessary to inspire the financial support that we need. Funding our ability to execute great programs is a very big part of what allows us to continue to be a strong financial partner going forward. With that said, people still really want our books and materials.
So here's our proposed collection line increases. We're really thrilled to see that our print book circulation has recovered after COVID and the disruption. We always want to be responsive to our patron requests and holds, so a healthy print budget keeps our wait lists low and our collections fresh. Ebooks and audiobooks is a different challenge. So that circulation is also up, but it could be up much more. But the pricing for digital books for libraries limits our ability to meet the demand. A single lease license of a digital book can cost $60, and an ebook, an e-audiobook can cost nearly $100 for a single license. So that's 4 to 6 times what it would cost a home user. So of course we see hold lists 6 to 8 to 10 months long for new titles. And we just barely move because it's just too much and we can't cover it. We attempted a different model for our literary luncheon title horse that allowed us to meet demand for a single month, and that single title cost $1,000. So that's clearly unsustainable as a rule, but we'd like to do what we can to improve our response to, you know, what is a demand in the community for digital items within these.
So communications and development, we are seeking to increase our budget really to match with what is in effect bringing back some event work that had been done in the past. We're going to be bringing back Spring Edition this year, which is another fundraiser for us. And that will increase our ability to raise money from the event side of the picture, as well as a line item for marketing. And the reason that we have a new line item for marketing, it's not that we weren't doing any marketing in the past, but we were pulling it from smaller resource. But we now have the opportunity and the obligation to really do more to foster rentals in our building, because that was a big part of how we said we were going to help self-fund. And so in order to do that, we need to have updated materials, collateral, and the ability to communicate out to the community what our services are.
So the fifth and the final expense category we're going to go over is facilities and buildings and ground. And Todd, probably to this point, digging in the most to your question just on efficiency versus have we hit our numbers. I would say we've done okay. And the biggest thing in terms of noise, again, we're 11 months into it. And our hope is kind of some of the noise in terms of filtering out, we're going to get things going. And solar is a good example that we have a lot of solar panels on our roof, and they're really just getting up and running. So, but to give you a little color on these three main items within the buildings grounds that we touch on. First, just on maintenance, the big change there is we had no landscape. So I think we're consistent there. If you, in our kind of our footnote here, in 2019, landscaping was 21,000. We're bringing landscaping on. It was designed to be as efficient as possible. And the estimates we have are 24,000. So we feel good about that number. Obviously, if people are walking by, the greens are just getting going. The cleaning services maybe been the biggest frustration in the regard in terms of hitting the number that we'd hoped. We, as we were preparing for this, we looked at the kind of what was said in 2021. And Lisa acknowledged there's going to be more cleaning at that point for more space, but had the number picked at more about 15,000. One of the things I think driving increase beyond that is the volume. You know, that was with an expectation that there'd be a 30 or 40% in more people coming through. And so the library's seen a lot more traffic, the meeting rooms, but also just the group that was doing the cleaning when we've gone out to look, they've retired and bringing a new group. These are the numbers we were seeing. So a number I would flag. And then finally in energy, this is continuing to move. You'll see we are flat. We'd hope to see a little bit more, in fact, improvement and with solar and things, but with the increased price in energy, we're holding that tight and really hoping we hit it.
Just on that, what would that have been in the old building, 2018, 2019?
Well, the old building energy cost would have been a combination of both oil and electric. And is it, where do you think we were on that, Cheryl?
Well, 2018.
You'd have to go pre-pandemic to get a good apples and apples.
That's right.
You can go forward and I can circle back, but I'm pretty sure it's in.
So I think on the cleaning, 360,000 people coming through the building. I don't think that wouldn't have been expected. So to your point, I think we can see the understanding that. I do on the maintenance in the grounds. I guess the question would be: is there anything to be done on minimizing that to make it as sustainable as possible, or as just lower maintenance as possible?
I think the run rate before we stopped landscaping because we were a construction site was about 21,000. So I think we're doing pretty well, given that we have such a larger footprint and the green didn't exist before. I think so. We're feeling good that it's at a steady rate compared to where we were before we had a green.
Maybe not. I'm not following you.
Well, so for the last couple of years, it's just been a construction site, so there was no landscaping. You have to go back.
That's what I'm asking. Yeah, no, I can't even compare it to what was there. Obviously, I'm just asking in terms of the go forward. It's a big annual expense, but the green is green. The one thing, I guess, it's the the rest of the
So the
landscaping.
town doesn't, Public Works doesn't do.
We don't own the land.
Okay.
Although there was a suggestion that they should consult with Tiger about how to squeeze a nickel on some of this stuff. You know, help review bids, that kind of stuff.
Hey Todd, I'm seeing in the board book on page 38 that the energy was 69,000 in fiscal year 2021-2022 in the old building, which, as was said, is a combination of electricity and oil. So we are moving up from that 6,000.
Doesn't really count.
Yeah, and also.
Although that tells you something, that would have been lower.
Yeah.
Probably higher than that, 18 or 19 then. That's the answer. That we should know. I bet you it's possible it is lower.
That building was a 38,000 square foot building. We're in a 42,000
Right.
square foot.
And it was a sieve too. I mean, it leaked, you know.
Literally.
Right. There was never any snow around
We
it
still have.
for good reason.
The water came through the roof too.
Okay. And the water came
I
through.
have the 2019 at budget at $65,000.
I mean, that's
but I don't know that we hit that.
That's not bad. Okay. That's good. I mean, I would say that's pretty darn good. But as you said, also the cost isn't the same either. The cost is higher. Good. Okay.
Slide, so just a couple overview, and then we'll move to the budget. And so on slide 22, make sure just relative size. And so these are the overall operating incomes for the towns, the various towns we compare ourselves to. We're about 70% the size of Darien. We like to push and feel like we give very comparable services for that 70%. If you go to slide 23, it's really the same numbers broken down as a different way, but just looking on a per person, what that looks like. And just as obviously, you guys, great partners in general, but specifically on the financing, an update in terms of just the building. Obviously, you only get to have this kind of update once for a building like that, but it was built on budget, the 40 million, the 10 million from town, the 30 million was raised, it was built on time. And I think maybe most importantly for today, you obviously gave us a $10 million credit facility to make sure our pledges could match kind of the bills that were coming in. We borrowed on the bottom end of that expectation. I think we had mentioned that it could be as high as 6 or 7. 4 million was drawn. We paid our first line of interest to clean up the last year in terms of the construction on Friday of last week. And so we owe you $4 million. And I think next month we're going to pay 38% of that down. There's going to be $1.5 million of principal paid, and we have in terms of our receivables matched slightly more than the payables. So I give all that background.
Okay, that's
hold me
fantastic.
to it. You get but I give that background as we kind of go into this next section of the budget.
That's
That
great.
hopefully there's some goodwill that we've been disciplined in our financials and kind of done what we said we would do.
Yeah. I mean,
And so as we go into
goodwill plus, I would say. Speak for myself. I won't speak for everyone, but I mean, it's amazing, right? I mean, on time, on budget, exceeded expectations on every level. And I don't think it was 4 to 6 million. We were talking about 12 in the beginning on the line of credit. So well done.
As we go to the scenarios and kind of just want to say again, we hope and we think, obviously you have to think about so many things when you're giving out the tax dollars, but this is what the town has asked from us. And you have to, yeah, so maybe I'll even point to that. But so on the top of this page is our base request. So this is the 9.6%, which in terms of an increase from town is 257,000. The fundraising, what we would bring is the 81,000, get us that roughly 320. That is the breakdown in the 5 categories. What the 7% scenario would mean would be 187,000 from the town. We would keep our 81,000 goal the same and would drop us to about 250. So we would be 70,000 short of what we just walked you through. That was kind of where we'd have to tighten our belt. On the next slide, 26, this is our ask. This is our counter offer to that 7%. Like to say it's more than half. We're not just splitting the middle, but it's called an 8% growth scenario. So again, we came at 9.6. The selectmen suggested a 7%. This is 100 basis points higher than that. Just to give you the numbers, instead of a 69, I'll round up to 70,000 decrease in the spend. It would be a 42,000 decrease in what we just walked you through. So what we're talking about is $27,000 more from what the recommendation was. This is, I apologize, a confusing slide or hard for you to read on the fly, so I'll try to give you the key takeaways. But the going down the left are the categories of where we would cut. Obviously, this is what the internal library has done. The first column is the 7% scenario. So we had to make up $70,000. The next area is the 8% scenario where we would make up for the 27. Then finally, just to give you context, that outside column is kind of what the overall metric would be. How much of a cut would this would be? The first 5 lines are what I call core operations. And you see they're roughly consistent with the exception of the art gallery, a little bit more in the 7% scenario, but that gets you about 15,000. And that would be consistent for both. Obviously cutting, but we think we would live well with these. The biggest difference is in the programs, and that's the biggest increase, so it makes sense. And what you'll see is to kind of get to that 70,000, we'd be cutting 24,000 from our original proposal. So a bit over half of what we're shooting to do and what we think the town has asked for. Obviously, it'll be a very meaningful cut for the children's programs and a little bit less for the teens. And then the collections, again, kind of 5 and 10,000 percentage-wise large in terms of kind of the numbers we walk you through. The 8%, the biggest uptick would be $10,000 for the programs and kind of half for children's and teens. And so, again, I know high level and we're kind of throwing a lot of numbers at you, but we wanted to at least have a conversation to present to you and maybe answer questions that we'd be excited for that 8% growth level. Obviously, it's not everything we hope and think the town would want, but gets us quite a ways there.
How did you get to the insurance savings number? Because I know we had a conversation about, there was a suggestion that they go on the town's insurance and they would have your insurance is significantly higher than what we pay. And so I don't know where you got that 3250.
So we dug into this and it actually dovetailed with when our actual renewal contract came up. And so they had told us, because it was such like a volatile year when we were doing the budgeting, they had suggested budgeting for like a 7 to 10% increase. And then they came back with actuals like 2 weeks ago. And so these are the actuals.
So this is not going out and getting a different quote from Kerma.
No, so
this is your existing.
This is our existing insurance.
Yeah.
And this is what
Okay.
we actually need. So this is
Good news.
Yeah, this is great.
Well, there could be better news.
No, sure.
It could be a lot better news.
What do we think the town would?
And
They used to be on Kerma.
They used to be
a. They requested to leave Kerma a year ago.
And do we know what that number?
We'll have to,
Just-
we'd have to, but I think we need, I think that needs to be a conversation,
My understanding is
given sort of the big
to
budget
hear
request.
What the numbers are for sure. I think that during those negotiations, there was not a responsiveness to Kerma because we were from Kerma when we reached out asking about our additional liabilities that were going to be coming on with our new building, the kitchen, all the rental spaces and things. We have more and more broken out coverage that we wanted to know and make sure that we had sufficient coverage for. And there was not great responsiveness of it.
It's interesting because they are Johnny on the spot with us. I mean, every day we're on the phone with them. They actually kind of drive us crazy a little bit because they're always calling us to ask us questions, so we're like, slow down. That's interesting.
Yeah. But we'll definitely hear the numbers for sure.
Questions?
I have a comment. So I'm seeing that usage growing by 68% is phenomenal. And I'm one of those people. I've been attending more programs, taking out more content, and every incremental user who walks through the door is experiencing learning and cultural appreciation, or more of it in their life. So from a taxpayer perspective, I would I would argue that the original submission is justified, and that should be a consideration as well.
Yeah. No problem.
Chris is the brief.
There's Chris.
Yeah, hi. So yes, Victor's point is very well taken. I mean, everything, the library has exceeded expectations in so many ways. The issue that Tom and I had when we discussed this library is that the promise of the green library and the benefits of the energy savings is something that is still in flux, and there is reason to believe that it will come to fruition, but you need another year or two of operations to see it come through, through the budget. And so our thought was, okay, why don't we let this growth happen, and let's take, on the offside of that, why don't we slow pace some of the growth in the programming? And so what I hope that these programming numbers that you're showing us have, it's not so much cuts in programs as a slowdown in the development of these programs. So Rob, maybe you can address that.
I think, not sure what
it's not perfect. Yeah, if only we were at the library.
He's looking at your face.
Very
Yeah.
absolutely. I'm just going to look at you.
There you go.
But
Well done.
But absolutely, that we are what we hope that next year and other reduction things, but that this program number will come back, and that we're going to say that's our hope in terms of delivering upon the revised number, or kind of whatever number we're doing for the program, and for me to have the pipeline of people signing up and the backlogs, and it's just an updated information. We hope this is, just as Chris mentioned, I mean, it's a great update from our perspective, because almost on every level the numbers are bigger than we expected.
Yeah, I mean, I would just add to that for sure we had a pretty candid exchange about how the narrative over the years had created fairly an expectation of some savings in terms of efficiencies and operations or whatever. And I think the answer is not that we're not going to see those. It's just they're not yet. This is still in many ways a transition year, as the team has laid out for us. The other thing to consider is in many ways they're a victim of their own success. This has been nothing short of a spectacular success for the town. And just if you can hear some of the details around just the size of the wait lists for the program is an indication our residents are telling us what they want. Right. This is where they want us to put resources for the town. So, when we kind of looked around, we kind of said, well, look, if you had to create some room here, and this is what we're asking of all the agencies of the town, please come to us with some ideas about where you could conceivably make a change. So maybe the requested growth in the programming would not advance as rapidly as initially requested. And so you'll see pulling back a little bit, and those are the items that are bearing the biggest burden in this proposal, in this scenario, is the programming. But again, remember, the programming is where you have 300 people showing up and you have 600 people on a wait list.
Is there any possibility of creating audiovisual Zoom possibilities for people to participate? Because I've been closed out of a number of programs I wanted to.
Yes, absolutely. Our technology now permits that to happen. So it is a possibility. We, of course, would like people to be gathered together in the room for purposes of, contact and connection. But of course,
so once it's filled, once it's already like capacity,
it's filled to go to Zoom.
Yeah.
Sometimes with some of these famous authors, they don't permit you to transmit. So there are limitations. They also don't permit you to record. So sometimes we're subject to those limitations.
Sure.
I just have a question. I don't know if this happens in other libraries. Are there any like for fee, like some sort of special something that's done on a fee basis as opposed to just free for the community?
Sure. So we do ticketed events pretty regularly. We just, and some of those are of course fundraisers for us. You know, we just hosted Melissa Benny Shea, who is Baked by Melissa. We had about 150 people in the room for her. It was sold out with a wait list. And we work with Elm Street Books very closely, as you probably well know. They purchase the books, we include that in our ticket price, and we charge a small premium in that case. There was food provided at that event, and so it really was a wonderful offering. But in a lot of cases, you know, librarians, what they want to do is be able to offer things with free access to the community so that there are no barriers to learning. And I think that's an important point to be made, is that that's a very key, essential part of the ethos of libraries. So we try to do what we can to, you know, again, ticket and fundraise where we can, but we don't want to overtax the community either. We want people to enjoy our programming for free to the extent that's possible.
And the programming, is it, the programming cost, does that go to primarily to lecturers or to the food or to?
Yeah, it's a variety of things. Some of it is about supplies. Some of it is about expertise. In the case of someone like a Misty Copeland, she had a very high speaker's fee that happened to have been covered by a donor that year, but you know, it was quite an expensive, in the thousands kind of range. So I think it really varies depending on what type of program you're doing. Kitchen programs are by their nature more expensive because you're just talking about often supplies or expertise that we don't have in-house, although we could bring Maria in perhaps for some of that. But
so budget wise, is it like 50% lecturer fees, 50% supplies, or is it primarily lecture fees?
For the adult programs, it's going to be more
lecture fees.
Can we jump back to slide 9? I think it's 19 in mine, although I don't think I have a couple slides. It was number 4, comms and development. Yeah, there you go. So just maybe, so I'm not sure what the consensus of this board is. I think there's feedback that it's working. You know, cutting programs may not be the right play. I think I'm hearing that as some feedback. On the other hand, other areas where there's probably not a one answer, 8 versus 7 versus 9. It may be a little more surgical than that, and it ends up being where it ends up. Maybe the right approach. But right here, I'm just curious, why would we increase the event expense and the marketing? Why do we want the town to pay that? Well, particularly marketing. It seems like marketing is our least of our problems right now. With 600 people on the wait list. Seems to be working.
Marketing is really about building out a digital footprint as well for us, working to improve our website so that when people are coming to look at our spaces and they arrive at our website, they can really see the full complement of what we can offer. And again, our rentals are, I think this year, we're looking to increase by $30,000. And next year, I think we're looking at a $78,000 increase. So we just need to be able to.
That pays for itself.
It does pay for itself.
That's the answer. That's the answer.
It
okay.
Does. And you're right. We don't need to advertise what we're doing.
In that regard.
Wise, I understand that.
I got it.
But we haven't had, for example, an annual report in a number of years, and those they just cost money to produce.
But I do think a big part is with the rentals. We hope that number grows.
Right. Yes.
Yeah. And that's a big jump this year, but that we haven't done too many. Yeah. So then we'll celebrate them when we have the successes.
Okay. That's a good answer. Other questions?
I think the other category also caught my eye earlier on too, in the expenses overview, 600,000. It just seems like it's probably a big category of things.
It's a big other.
You know, maybe you probably have greater detail than this, but that seems like a pretty large number for others.
Yes, and in fact, in the we have the full budget back there in the back further in your slides, but it is in many ways. It's a lot of the software. It captures some things, like one of the things Tom mentioned, a $9,000 caught his eye. Our accountant fees went up $9,000 this year, and a big part of that is this year again, hopefully growing pains. But we're juggling the operations, closing of the building. There's a capital campaign, and also the work we're doing on the legacy. And so they were just doing a lot more hours, and also I think so. It's a lot of little things, and hopefully you saw that we tried to catch those 5 items in terms of where we'd cut. I know it's a high level answer to kind of asking for specifics, but most of it's the software and the day-to-day of the operations.
Okay, thank you.
Yeah, it is in the back, actually. If you look through, there's hardware, software, right? That's a call out. It's a good chunk. Okay. Okay, other thoughts, questions? I think the guidance is do what you can do with the, you've got cuts that you've and some ideas. I don't know about this insurance, if this is really an opportunity. I'd like to at least explore it. If it is, it is. If it's not, it doesn't work. We get it. But just to help us from that kind of point of view. Do we need a revised number back from you? Probably, right? We're going to need something in a couple of weeks when we vote in March. So whatever is coming up or going down or whatever, we just walk through. I think we probably ought to do that. Maybe plan on just a 15-minute spin through of whatever you've changed. Sure. I want to do it that way. That fair?
And have the conversation about the insurance, see if there was something. And that makes some sense.
And you'll have money in the bank you didn't know was coming.
Yeah.
Excellent. Okay. Anything else, team?
That would be on the 27th.
Does that work? That meeting's going to get long. It's to call it's only my wife's birthday. It's okay. Every year it's a directive. Okay. Thank you very much. Chris, did you have anything else? Sorry, I didn't mean to cut you off. Did you have another? Bob, no, thank you. Great job.
Yeah.
Okay, thanks.
Thank you.
Thank you, guys.
Great story.
Right?
Oh, yours was 7?
Yeah.
Here's 9.
It's interesting. I was unaware of it.
Here's, I mean, but not in his.
The lawyer in me.
What's it about?
So, right, so that puts the whole comment.
Yeah, and why didn't you don't come here for that? Right.
Interesting.
The meeting's tomorrow.
Yeah. That made my hair so no. Let me speak.
Hey, Ann. Hey, Josh. You're right. Right.
Okay.
All right.
So, general government. This includes first selections office, finance, HR, IT, land use, building departments, the voters and registrar of voters, clerk, parking. So we have a lot of departments to cover. So I'll go through each, highlight the highlights, and just if you have any questions, let me know. So starting on the expenditure side, the first selecting department is a decrease of 1.29%.
Do you all see that?
Look at that.
Yeah, we all see that.
So impressive.
I'm sorry, could you repeat that?
We're gonna go backwards on yours.
We're going backwards.
Bob's right.
A 30% decrease in salaries part-time. The town is currently evaluating all of its part-time needs, and as projects drop off, so those needs. Economic development is dropping by 48%. A number of projects have been completed in FY24, so the previous level of funding isn't needed anymore. Meals and events is going up 1,500. This is used for recognition events, retirements, the 2 major employee events every year. And this is coming up to meet the 24 year-end expected actuals. The supplies office is going up $1,000. This is to change the black and white copier on the second floor here to a color copier and make room for the supplies needed for that, since we're the only floor that doesn't actually have a color copier on it. Any questions on the first select one? Okay. On to finance. Finance sees a 5.27% increase. Salary part-time up 17.3%. This is due to the treasurer position getting a salary bump from voted on by town council last year. Salaries OT.
From what to what?
It's a great question.
It went to 45, so.
45. It went to 45 from
14.
20. Well, last year was 35. I think that was an intermediate year, and it was 26.
20, yeah. 20. 35 to 45?
It was 26
Sorry.
to 45 with a half year last year, because I think it's mid-year that it goes.
And it's both internal.
Salaries OT went up 5,500. Right now, finance, we're working on streamlining processes and evaluating if we need an additional full-time employee. So before adding anyone else on, we're making use of the staff that we currently have to fill those gaps. Training is going up 4,900. This accounts for, it's kind of a cyclical thing. There's every other year we go to a GFOA in-person event, as well as having Munis and GFOA staff trainings for the finance department, as well as the departments throughout town hall who get trained on various aspects of Munis and so on. Professional service audit is down 14.5%. This is reflecting really the actuals from the past years and the possible fluctuations due to going out to bid for a new audit firm. Any questions on finance? Okay. The tax assessor's office is seeing an increase of 5.4%. And just as a general theme, Jen had actually mentioned this in her presentation, the 401A contribution went from 6% to 7%. So you'll see large increases across the board in a lot of general government departments, since we have a lot of town hall union employees. So of the 19,500 increase in the tax assessor's office, 18.5 is due to full-time salary because of stepping employees. And
is the 401A, is that under just, that's the contract we have?
Yeah,
that's part of
was,
it. Yeah. Makes sense.
The only other difference here is the service contracts dropped 2,500 to reflect the actual quoted price from QDS now that we're on their cloud software for next year. Any questions? Okay. To the tax collector, this sees an increase of 3.16%. Salary part-time is dropping 50%, about 3,000. Again, the town is reevaluating part-time needs in all of our departments. Training and travel are up 700 and 150. This is accounting for the training of a new employee, not a new FTE, but a new employee in the tax collector's department. I guess education to gain their certification as a tax collector. Any questions on the tax? Okay. So legal right now, we have a 400,000, which is flat from FY24. There is currently, or will be in April, a DPW union contract negotiations ongoing, as well as us anticipating a decline from its peak in 2023 of 469, was what the actuals were at the end of last year. And are there any questions on it?
So I was just going to ask the first selectman.
Yeah.
I was on the call earlier with town council members going through this, and there were actually a number of questions about where the 400,000 comes from in terms of, does it include everything for the 830G challenges?
Yes.
And everything else?
Yeah, so I had a conference call with Ira Bloom in advance of going through the budget for the submission. And this was originally at 425. And, he did not think, based on what was in the pipeline, and he has all the 830Gs, he said, I do not believe you will need to go beyond 400.
Okay, good. That was.
And we are going out for an RFP on legal services. So hopefully, we'll get some.
It's been an area where we've run over budget consistently.
I tend not to like to call the lawyers unless it's absolutely necessary.
Don't ask it personally. Don't ask them how much they cost. You want your questions and you're asking how much it costs. Your number's going up.
Meters running.
Just hold the lawyer.
It's good.
Is there a reason that the legal fees are not broken out in 24 and proposed 25?
So they get broken out kind of as the actuals come through. We budgeted just as a roll up in professional service legal. And then as we hit the other accounts, like for P&Z, then that number goes up and we take it out of the professional services legal budget. So you only really see it in the actuals, and the budgeted numbers never really get separated out like that.
Okay.
And is that a little strategic when you say you're gonna do X, then you just invite?
I guess.
I mean, it seems to me like it's sensible not to ask for trouble. Defer to the lawyers.
After reading too much into it.
Defer to the lawyers.
To the HR department, HR sees a 2.5% increase over last year. This is due to a couple factors. State drug and alcohol testing prices have gone up, so there's $1,000 increase to account for that. Training has gone up by $1,000. HR kind of is a magnet for other departments in terms of when they run out of training in their budgets, they come to HR, and that obviously sees an increase. Advertising, this is for job advertising, is dropping 2,500. This is because the town's jobs are done either through ADP and also listed on the town's website, so it's no longer needed to advertise Glassdoor and so on. Any questions on HR? Okay. IT. IT is the increase of about 27%. This is led mainly by two factors. The first being that they're asking for a new FTE, so their full-time salaries is going up 23%. The IT department was created in 1998 and had 2 employees. They got their 3rd employee in 2003 before the first iPhone. And 20 years later, they're asking for a 4th employee. And in those 20 years, they take on an enormous amount of responsibilities, least of which being cybersecurity training, but it's just every service that the town signs up for, IT has their hands in, troubleshoots, works with departments and maintains. So I think at this point, after 20 years, it's gotten to the breaking point where it's time to kind of have a full-time person there.
So they got to you. So
they got to me.
They got to you. Look, no, they do amazing work for everything that's coming their way. $620,000 on what's the total general government number?
The full overall expense.
The general government.
Not the whole budget.
Yeah.
Just
Look at what that number
government
is.
number.
Well, the town is 30.
I was going to say 40. Would have been my guess.
Well, but that's not just general, that's the whole town.
But the whole town.
Okay, but the whole town uses IT.
Oh, yes.
Yeah.
Including volunteer.
So just to refresh everyone, just to do the bidding here, 600 grand on 40 million. It's not a lot of money, right? It's as a percentage of that spend.
Private sector spends.
For that, and what they do. Now, they don't have the schools. That doesn't include the schools. They work with the schools. They do, but they have a budget as well. Yeah, but the library and everything else. So I just want to point that out. I appreciate it's a big jump, but it's been well managed.
Percentage-wise.
As a percentage, it's really
budget.
It's pretty small.
Actually, my understanding is that they don't cover the library. I think the library has their own IT department.
The network, they work on the network, they support the network.
Yeah, okay. But in terms of like IT troubleshooting, they have
The
people.
wire and network is something that they have to constantly maintain.
The other large jump in their department is 40,000 in service contracts, 30,000 of which is from OpenGov that got consolidated into their departments, as well as 10,000 of yearly increases from the current contracts. The only other increase really is voice and data. 700 is a new devices for their anticipated hire. Any questions on IT? Town clerk. So town clerk and registrar of voters, you'll see kind of the same trend. FY25 is going to have a presidential election. There's early voting, which is a new thing to take into account. 6 voting districts versus 3. And looking back 4 years, it's not really the best, look back. So Town clerk has salaries full-time up 7.35%. This is mainly driven by the town clerk's position also having an increase voted on by town council last year. Salaries part-time elections, and salaries overtime have an increase altogether of about 8,000, and these are all election-related expenses. Postage and supplies office have an increase of about a combined 5,000, and those are also election-related. Salaries, supplies office is mail-in ballots, and of course, postage is needed for those.
So I always struggle with this. Why? Because every year New Canaan is an election year. So why?
Election,
why?
I think it draws a bigger crowd. It probably has a bigger turnout.
Why? But does it?
Yeah, talk to the expert down there.
Does it?
Down there.
And so, but in more people putting in a ballot, and that exactly matters because absentees. Okay, fair enough.
For early voting, I'm not sure if that
People go
applies
to
to.
town hall.
In general elections,
Everyone remember this. We're going to play the videotape next year.
the general election, absentee
comes down
ballots
next year.
run
I'll buy everybody
1,500. And it's a huge number.
Yeah, it's 2.5 weeks of early voting, and you have to be open on Saturdays. And is it just Saturdays or Saturdays? Is that there's like a significant increase in hours that they're going to have to work. In the
Well, there is a grant that
it's
covers
$10,000 grant.
Is that in there?
10,500.
It's taken into account.
So where would that show up?
It's not going to show in the general fund. It's in the grant fund. I think we already
Victor's having a conversation with my IT in the library.
We didn't get, we didn't get it yet. We got it a little bit.
There's also a $1,000 increase in the outside contract service because of the COT software that's expected to increase next year. Any questions for the public? Okay. Same story with the registrar of voters. That's up 18.5%. Their overall budget is, it was under 200,000 last year, so it's becoming above that this year. Part-time salary office, part-time elections are up 13,000 between them, of course, related to the election. Training is down to 2,000. This was adjusted to reflect some historic trends. Training will be probably required in a couple of years when new hardware, new equipment comes out. Election personnel and support are up about 20,000 between them, election related. And canvassing, postage, and supplies office, which is in-person ballots, are up about 2,200 between them. Also, election related. Any questions on the registrar? The building department. So these two are a little tricky. Building and land use have been separated out into two different departments. So you'll be looking at the percentage increases off of the revised budget from 24 after that separation had taken place. So the building department saw a 2.9% increase over their revised 24 budget. The service contracts was reduced by 4,000. This is due to OpenGov, and so their prior software no longer needing to be in their budget as it's in IT right now. Professional services sees a corresponding 2,250 increase. This is for two things: anticipated affordable housing transcription needed, as well as looking to have an electrical inspector to handle a lot of the new complex systems, such as EV charging, energy storage, CHP, solar. This is a lot of electrical work that can't be done by the staff that we have, since it's on the more complex side. So it's kind of hiring professionals to handle that. Any questions on building? Okay. On to land use. Land use is also a tricky one to look at. It's down 9.25%. That's due to mainly professional services dropping 72,000. That's where the POCD was for FY24. Right now, there's 65,000 in that account. 15,000 for anticipated transcription services, and 50,000 for anticipated zoning regulation updates and implementation of a plan based off the PSC results. There's also an increase in overtime salaries of 2,000, which equates to 2 hours per eligible FTE per week. Much of this is used for kind of in-house transcription. Any questions on land use? Okay. So we're grouping a couple together here: health, pension, OPEB, and insurance. So the contribution to town benefits health fund is up 3.3%. This is currently being reduced to kind of reflect the differential between the ADEC and and us expecting to pay claims out of the OPEB trust.
Is that reflected in the three or no?
It is reflected in the 3.
Okay. Is there more to go there?
As the months go on, if the 12-month look back changes, it may.
Okay.
So it's 7.6 is the estimated cost. Right now, we pay about, the deductions for employees are about $1 million against that. So it brings it down to 6.3 for the town side. So it's in that ballpark right now, but
we'll know more in 2 months.
Okay. Okay.
And we're, as Josh said, we're also taking in, it would be 300,000 we're taking in again. The differential between the ADAC, which is that actuarial determined actuarial employer contribution. The difference between that and what the claims are expected is about 300,000. So that's coming into it as well. But we're going to take 300,000 of the claims again, like we're doing this year.
Mm-hmm.
Next year we plan to do the same thing. So that took it down to 6.3.
Mm-hmm.
Next is the 401A contributions. This is specifically for Board of Education that the town contributes and matches the 401As. That's up 7.4%. That's a number given to us by the Board of Ed. Wellness is up 2,500. This is a line that's used by all departments, and utilization of this program is up. So this is to reflect that. The town pension contribution is based off the Hooker and Holcomb report. Workers' comp. Right now, we have a placeholder of 3%.
Sorry, before you jump off the pension, when are we meeting? Are we hearing from them between now and when we vote on this?
Yeah, she's
The ADAC, you mean?
Well,
we'll have another ADAC.
Yeah, we'll have another RPEC meeting.
Yeah, we'll read.
Yeah,
the
the
ADAC,
RPAC
which will bring
meeting's
it front. Yeah, so you get a performance report then.
From Hooker and Holcomb.
Yeah.
Yeah.
But this is their number right now. So their number won't change. They set that number July 1st of every year, and they set the ADAC for the year forward. So this is their number for our budget.
Again, just like to see where are we? Are we 110% funded or?
Oh, we're 81% funded.
On OPEB?
That's OPEB.
OPEB, 106.
I was gonna say, if we're 86% pension, where was I? Did I fall asleep too much? So we're 106, not 110? Okay, 106. Okay, all right.
It's interesting to know the interest.
I was away. That one, you're not gonna slip past me. Okay.
Lastly, workers' compensation. Right now, it's a 3% placeholder. I think we're just kind of getting in more accurate numbers now, and in the next week or so, we'll be replacing that with something that's closer to what it should actually be for 24. But it's very close.
Yeah.
Any questions on these three? Okay. Parking. So parking is up one.
I'd like to put it out there as a marker. Let's not forget and come back to that 505. Could that be 405? You know, we'll, as you said, we'll get smarter as the months go by here. The town pension contribution of 505. I know that's their number. As we get into this in April and May, we'll take a look at that again to see if that's a good assumption.
They typically advise against changing their numbers mid-year for just to give you how because we asked the question, could we change it, because the fund changed from when they did the study. It increased from when they did it July 1st to now. It would be incremental because any gain would be smooth. So they,
Peace. When did they give us this number? I'm sorry.
it's July, so they do July 1st of 2023.
Yeah.
And then they give us an audit report. So they give an estimated ADAC for next year.
Yeah. And that's this.
And they set it at that date.
Right. For January for next year.
For next year.
Yeah.
So when
I
they
want to
do-
make sure that we're not looking at a July last year number.
No. So
Okay.
they'll put July 1st of 2023 is when they do the
Mhm.
study.
Mhm.
We get what we call our GASB report sometime in November, which gives us that estimated ADAC for 25.
So far, so good.
And then that's what they will use for 25.
Yeah. Okay.
Because when they go do the study now for July 1st, 24, it's for the 20.
You'll get the GASB in November of the
Yes.
following.
No, I agree. I mean, it would probably look a lot lower if you did it in real time. The problem is it'll work against you some years, but
That's the
Yeah, that was.
I get it.
practices,
I get it.
but why not take the benefit?
I get it. I get
there?
it.
But no, it's a philosophical decision.
Yeah, we'll talk about
Yeah.
that.
Because you could.
It's overfunded. There's nothing to
Well,
mess around with.
106.
That was, it's not at 106 today. No chance. It's 110, I bet. I could be wrong, but I don't think I am. But anyway, doesn't matter. We'll move on, but just.
Robust. Yeah, no, they've been robust for good. But yeah, you would.
It's okay. All righty. Anything else on this page?
So if there are no other questions, I'll go on to parking, which is up 1.5%. Parking has a decrease in salaries O2 of 5,000. This is being reduced to match what the actual anticipated uses are for historical data. There's an outside contract service decrease of 5,000 also. This is an expense that has a corresponding revenue. It corresponds with how many parking tickets we give out. So the less tickets we give out, the less of this expense that we have to pay. So the ticketing in town has been trending downward, and so this expense. Property service contract is down 100%. This goes for leasing of the telephone lot for business permits, and that's no longer available to lease, so that expense is going away. Supplies signs is down 100%. This was $4,000. That was really utilized by DPW for signage in parking lots. It's now just been moved over to the DPW budget, so they can utilize it for the same purpose. Banking and transaction fees. It shows as an increase of 50+%, but in reality, it's really expected flat. The increase is really a one-time increase to kind of reflect a correction in how we're accounting for the revenue. The revenue is now no longer being netted on the revenue side. The revenue is being booked as gross on the revenue, and the fees that come out that are associated with it are being booked on the expenditure side. So for the general fund, it has a net zero impact on it, but it's just being reflected and accounted for properly. Any questions on parking? Okay. On to 3 more: debt service contingencies and interfund transfers. So debt service right now we're seeing as flat, other than a small increase of 63,000 for the BOE IT tech lease. Salaries contingency is at 375,000. This includes non-union cost of living increase, DPW steps and COLA, which are currently being negotiated, as well as budgeting for 261 instead of 260 budgeted payroll days during FY25. This, along with transfer to tax supported capital, which of course you know is a moving number of 1.97 million. In past years, we've utilized more bond premium balance that we've had, and tax supported capital fund balance that we've had. So right now, none of those are being applied to the tax supported capital. We're currently analyzing the extra duty fund, also the tax supported capital fund, and any additional bond premium that may be eligible to go against these projects to see how much we can bring this number down, as well as any projects that get paired off along the way.
When will that be done?
So the premium, we have an estimate on the extra duty fund is about 100 to 200,000. We're truing that up right now. The tax supported capital is probably approximately just under 300,000.
Yeah.
And of premium, we're going out to bond between 25 to 27 million, which hopefully we close the Tuesday before you have to vote. So there's 500,000 of premium already built in the revenue side coming in to go against interest. We possibly could get up to 1.2 or 1 to be conservative right now because it's 6% on a 20-year. So we could have a possible, 500,000 more there. So you're talking 800,000 plus that we could have coming back in as either transfers in or against the interest for premium.
Salary contingency. Aren't those things all at Public Works and like why are these embedded in the
here and then in the revised budget? So that's why 24 or any of them, we separate it out between the different
when they're open contracts.
Any other questions on these three?
So I wanted to mention this before. We need to be keeping track of every area where we think there could be opportunity for saving. We talked about the capital at the Board of Ed. They'd come down from their report, right? They're looking to find the million that we asked for. You just added up to another 800,000. I want to make sure we're tracking all this for the next few. Okay, yeah, I went with the running tab here.
So that is it for expenditures. On to the revenue side of things. Finance revenues is budgeted for 62% of an increase. This is because of two things really. Interest on investments is up to 2 million, which is an increase of 1.1 million from last year. Rental property finance sees a decrease of 380,000. This is that we're no longer expecting the Board of Education to repay the town rent at 220 Elm. And we are now including the state grant, the town aid road grant, which is a 332,000 grant that was we used to budget it as a part of the pavement management program capital projects, but that's now being just seen as revenue in the general funds to offset some of those similar expenses.
So just make sure I understand the first line. We budgeted 900 for interest on investments. We're at 700 through December. Thank you. And you are picking 2 million as your number.
So I have
working with the treasurer.
Yeah. Well, but the Board of Selectmen budget had year-to-date number of 1.4 million. Oh, I saw that. To go dig. Anyway, Andrew can solve it.
What Andrew and I have realized with his number and what we present at the financials are only just the general fund. So the numbers we give and we're giving you the financials are just one fund and the revenue that goes in there. When Andrew does his presentation, he takes all the funds that we have and all the interest that are in all those funds.
Okay. And that's the 2 million.
And that
no.
2
million is just
the
general fund right now.
Okay, so the total number and those other interest incomes.
So
the other interest incomes would go to the sewer fund, would go to.
We have a couple of other money markets, the grants, the sewer.
Okay. But where does that revenue go?
The revenue stays, the grant one stays in the grant fund.
Okay.
They'll stay in the fund where they are unless there is special revenue, which can be taken back into the general fund because I actually have most of all those funds are pooling into the general fund. The ones that are separated are ones that we should keep separate because the grants shouldn't be commingled. So that money stays in the grant.
Go ahead, Andrew. You have some.
Yeah, I think in that recent discovery in terms of like what I've been presenting versus the financials that are presented at the monthly Board of Finance meetings just being general fund. The 2 million, I was factoring in interest earned on all of our cash. So that might be something to consider. Although, and I do have a presentation here I'm happy to walk through, And I know it's late, so I can go quickly if that would make sense about how I arrived at the 2 million. I took 3 different approaches.
2 million for what now? For the entire
That's
town or for the general fund?
That had been for the entire town. I would say though, the general fund portion of that is at least 80% of that.
That's $1.6 million. So of the, I just want to make sure I'm clear. There's, let's use it just for example, is the sewer fund one of the funds where you're able to generate some interest income?
Yeah.
Okay, that can't come into the general fund. That has to stay. I'm okay with that. I just want to be clear to everybody. It's not like we're earning it over there and nobody, it has to stay there. Now it reduces whatever expense we'll have over there, of course, as it's income.
Right.
Okay.
Exactly. Any interest earned within different funds should stay.
Well, I think you need to let us know
Sure we're apples.
where are we here exactly.
Exactly.
So you're saying it's $1.6 million if this is representative of the general fund.
I would say $1.6 million or $1.7 million.
Okay, and the 712 is
That's actually.
that's you through December, so, okay. So it's 100,000 a month-ish, a little more than that, 150. All right.
Now, the other thing though, in terms of the actuals, the way treasuries accrue, they accrue interest and then pay out the interest at the end of the term. So a lot of treasuries we actually have maturing like later in the year.
Okay.
So we're going to see it's like what's reflected now is actually probably lower than expected.
Makes sense.
Within the 12-month period we're talking about.
Makes sense. Okay. All right. Well, I just want to know, did we just lose $400,000 of income here? And if we did, and I appreciate it's elsewhere in your analysis. No, your 2 million is right. I'm sorry.
No, the 2 million, Andrew was saying it's for the whole town.
Okay, so
it has to come down to the 1,617 to be just general fund.
Now, the fact is it's hand-to-hand combat and it's a really unknown number, both rates and you guys do a great job of aggressively moving money into interest-bearing accounts. The banks obviously want to keep it in non-interest-bearing accounts. So you'll have to keep that up. But Andrew was talking to, about a possibility where we're gonna have big bond proceeds and those are gonna, for a while until we spend them, we're gonna earn interest
money on them. Sure.
And that's different than last year to some degree. So that could help. I don't know if that you factored that into your $2 million or $1.6 million number, but there's some,
I have like
numbers.
A note about that in my presentation. I did not factor the number that I gave back in January when the process began, did not factor potential interest earned on the bond issue that we're going to be doing in a couple months.
We need that then.
So that's a positive. And also,
but I do think that additional interest could account for some of the
delta
that we're talking.
So we're somewhere between $1.7 million and $2 million. Okay.
And
that's
we
fair.
just learned we're getting a couple, what are we getting from the library? I mean, that's more interest on that. Yes.
But is it fair to say that the interest earned on those bonded funds, that would be reflected?
No, so bonded funds, so the bond, right now, the bond,
that'd be separate.
the bonds are, let me back up. The general fund is owed 20 million back from the capital projects because it's been floating those capital projects. So that's 20 million we would have normally invested. So we get that back sometime in March. There's a differential. We can't do a lot of investing with that 5 million left because we got to keep it lower than the interest rate we're going to get on the borrow. Once that 20 million in March comes back, we just gave you 15 million now to go out. We spend about 12 to 15 a month. So once that, now that we've put 15 out, by the time March comes around, that money that's going to come back in is going to need to support. It may be able to go out for a month. So at that point, you're putting it into the money market, pick up that return. Then once we start July again, we won't have that bonding problem where we've been supporting these massive projects. We should be able to invest a little bit more from July on, but the next 6 months are going to be tough with how we have to pay back who. And
but you will have already earned, for the most part, we'll have earned all we're going to earn this year. Budget was 900. We're going to crush that.
We're definitely, yes.
The question, so that you're talking about April, May. The question really then is then in June, the money comes in July and you don't have the bond again, you have the whole back. I think you need to come back and walk us through the bridge between 1.7 and 2 with what Bob just raised and anything else you just might have learned. Okay. Okay. So that's a possible challenge for us right now. So, okay, fair enough.
Yeah, we need to account for that. So I don't know if you'd like me to.
I don't know I don't know what you're gonna tell us. We need to know a bridge between 1.7 and 2. You don't have that.
The approach that I took is going to be, I actually took 3 different approaches and an average.
It's really interesting just real quickly to hear
Yeah, go ahead.
interest rate assumption, just because that's a big driver.
Yeah,
Right.
sure.
And then I can go back and tweak it to include some of these extra balances that.
Okay, that makes sense.
I'll plug them in. But I just go over a quick background about the rate hikes. We're between 5.25 to 5.5. Big news last week or within the last couple of weeks is the labor report was stronger than expected. So the rate cuts are actually going to begin in March as had been originally anticipated. So that means we're actually going to continue earning at a higher level than we were expecting just even a month ago. So that's good news for us. I just wanted to share, there's a little chart. This goes back 25 years. It just shows that we're at the highest rates in the last 20 years. And you can see that there have been steep declines, but those have generally been associated with really sharp recessions. We're not expecting a sharp recession this time. So I think that a lot of the projections are that we're not going to see a plummeting down to 0 interest rates at the conclusion of this rate cut cycle that we're about to embark on. So the operating assumption I've been going on is, from looking at some of the research, that by June 30th of 2025, we're likely to see interest rates, down to the 3.5% to 3.75% range. Again, a lot of the rate cuts are going to be just 25 basis point cuts. We're not going to be seeing 75 basis point cuts. That's not expected. And so I have a chart here just showing the average interest rates. You'll see for 2023, we're averaging around 5%. The blue line is the Fed funds rate. In 2024, the average is just shy of 5% because again, we're going to see maybe, 3 rate cuts at, 0.25% each by end of 2024. We will be seeing some rate cuts in 25, but again, we're accounting for the first half of 25, which the rates will be higher. So the overall average for 25, where it has it down to like 3.2 here, because we're looking at the first 6 months, it's actually gonna be a higher number than that. And so those were some of the inputs to the assumptions I made.
Okay.
And again, the assumptions are likely to change as some of the underlying information changes. But the first thing I did was I looked at what is our average cash balance month to month, and I'm including cash and investments, right? And that's $68 million. I went back 3 years, took an average of our monthly balances. So that's accounting for both the peaks right after tax collection season and the valleys right before tax collection season. I then applied a blended rate of 3%. And I arrived at that number because we're earning a higher yield right now on our treasuries and money market account balances, and we will continue to earn higher yields on those balances even as rate cuts get implemented. Our pooled cash, which is our main checking account, that earns a lower rate, and we generally keep about $6 million in that account at all times, roughly. And so that, as well as agency issued securities that we bought 4 years ago that are going to be maturing over the next year or two, those are also earning like 1.5%, and that's fixed. Those rates are not changing. So I accounted for that. I blended the rate based on the apportionment, and I actually have here. I took another step further, and I looked at applying the individual rates that I'm anticipating, the average rates to each pool of funds, right? So those agencies I was just talking about, we've got 9 million right now. Over the next year and a half, some of that is going to mature, and I'll be able to reinvest at higher rates, right? So I just want to note that. Pooled cash is checking.
Higher than those rates?
Yeah.
Yes.
Higher than the one.
Higher than 1.5.
Yeah.
Because we're not going to see that terminal rate go below 3. So we're going to be able to start earning double on some of those balances. The reason why we haven't sold them is because, if we did, we would realize losses, right?
No, that's fine.
Maturity.
Yeah,
we don't want to be
course.
Silicon Valley Bank.
Yeah, it's a ladder.
So treasuries and CDs, though, the yields there are actually quite good, even going a year out. Even right now, they're just under 5, they're at 4.95. I spoke to UBS today. And so thinking about the durations that we currently have, reinvesting. We have a big tranche of that, about 5 million coming due in August that I'll be able to layer out further. Those are funds that are more unassigned fund balance reserves that we don't expect to tap into. All the money that Ann's been talking about transferring to me, like more recently, 15 million, I've been mostly investing that in shorter term, because we're going to need that money back to pay bills as we get, further in the fiscal year. And then money market, again, those rates are always about 50 basis points less than what we could get on a 3 to 6 month treasury. And we do keep a sizable amount in there, again, as a buffer to transfer into full cash to pay our bills. So that's kind of how we manage liquidity risk. And again, money market funds held at Webster are fully collateralized.
That doesn't seem like a great rate.
Well, this is a future forecast. Right now, we're getting 5%.
This is a guesstimate based on some rate cuts from starting July 1.
So I negotiated 5% rate that we've been earning since August.
Who knows?
Who knows? Who knows?
We could be right where we are. We
could be at 4.
Typically, what the bank rates are the first to fall. The second rate cuts start happening. So I'm being conservative.
That's okay. Okay.
We may earn more than 3.5, but I'm projecting they're going to start slashing.
We like approach 2 better than approach 1 because you just closed the gap so far. I'm really looking forward to approach 4. We're waiting for approach 3.
And that's what I want to show. Even with these conservative numbers, it's 2.2 million. Now, again, some of this money market money is the money that Ann was speaking about, which are sewer and grant funds. Although those funds, I would say, what's the total balance there?
No, they're small, but it's only, small.
It's like 5 million.
2 million a piece in each one of them.
Right.
Which that's not used for funding our ongoing expenditures.
It's a couple 100,000, but it rounds you back down to 2, which is the number that we want for this number.
Right. I just want you to have an idea of what piece of this was sewer and grant money, and that's about 5 million of that.
Yeah, I think it's not as bad.
So again, I don't think it's too much tweaking in terms of trying to land
all right
where we want to. And then the third approach and final approach is, and I spoke to Janny Montgomery Scott. One way that forecasting is done is you look at the last 6 months of earned revenue, right, or interest and dividend income. You double it to look at, what would the year be, assuming current rates stand. They're not. And then you reduce by the percentage that the Fed funds rate is likely to drop in the next 12 to 18 months. And so that's about a 30% reduction. So I apply that 30% reduction, and that gives us our lowest estimate of the 1.6 million and 1 point.
Except based on the lumpiness of we're going to do better in the second half. That
right. So, and I also wanted to note, I have a caveat here as well, that 6 month period, again, does not include accrued interest on the treasuries that we have. We have a lot of accrued interest that has not yet been earned. So that's not being doubled and then reduced by 30%. So I think this number is underestimated. Right. This was the lowest estimate.
Well, you know what? 2 is probably a good number then, listening to that. No, I'm serious. I mean, I end up, no,
I agree.
I think it's probably.
So, this is the last slide. Just to conclude it, I averaged the 3. I didn't really think there was one that should be weighted more than another. But I averaged the 3. It arrived just shy of the 2 million. And so that's why I came up with that number back in January.
Well, we need to make the 2 too.
Other funds. So this is it's not coming into the 2 for other funds that would earn that interest versus the general fund. That's what I want to make sure
we're talking past each other.
Yeah.
Right.
Yeah.
I think
what I heard is scenario 2 probably could happen, and that's $200,000 more than the 2, but that's from the other funds.
Right.
Is my point. So rounding to 2 actually makes sense.
Right. And if we take out that 5 million that I was including in this total number, right? But we're going to be getting 20 million in bonded, money that we're going to reimburse the general fund with, 20 million in money that we had previously spent. I think that's going to more than account for not counting sewer and grant money.
But you only have it for 2 months, a month and a half, 2 months. So I just want to be clear with the cash. So our static cash flow, we have 20 million that you have out at all times.
Right.
That's stuff because that's our fund balance, and that's fine to keep out all the time.
Right.
Then we have this extra 20 million that I funneled from other accounts into it. That needs to come back quicker. So that 20 million was used up by the capital. It's going to come back in March. I'm going to need it back in May. So I just want to make sure that
it's still 100 grand a month.
Yeah. So be careful.
Ish. Yeah. 75,000,000. Okay.
Thank you.
So
thank you. Good analysis.
Illustrate
very
the
good
thought process.
Excellent. Okay.
Any questions?
I think that was great.
Thank you.
James? Michael, we lose Michael up there. Michael usually has a question.
I'm good.
You're good?
The interest rates discussion is a good one, so.
That's an important one. Okay,
Yeah.
let's keep going.
Okay. Back to finance revenues. Any questions on,
Thanks, Andrew. That's terrific.
any questions on the last two on this list? For the property expenses? Tax assessor and collector. Most of these are pretty much just plug numbers. On the tax assessor side, the state property rebate, we get that number from the governor's biennial budget. Sometimes we get more than that, the 28,000. Sometimes we get less than that. We'd like to keep it at what the estimated number is, and that anything extra is nice. Tax collections current is just a plug number to balance the budget, minus whatever the 5 million drawdown that I have in there right now. And that obviously changes until the mill rate gets set. Tax collections prior is 300,000 and liens, fees and interest are 250,000. Those are just flat numbers we keep every year. Any questions?
Only on tax collection prior. What's N? What's overdue? We have a, do
Real
we?
estate is the bulk. I mean, cars are in there.
Well, what is it? What's the number? Do we know what's over? We know it's overdue. We don't really. I guess we won't know.
How much?
Yeah, be curious.
2013 is $516,000.
I think there's some big ones out there. It's probably close to $1 million or 700,000 ish.
A little bit, yeah.
I know there's some big ones.
I'll look at the tax report.
Is that more or less? I don't know. I mean, that seems like when you're over $1 million, is 300 too low?
I don't think it's too low. It just.
It depends on what proceeding they are with the real estate, because that's where the big numbers comes, and that's where the spike comes when the proceedings go forward on collecting those taxes. So I'd have to see how many are in that stage.
Okay.
To know.
It'd be good to know. Be good to know.
Yeah, we didn't have a lot of, Sunny didn't have a lot of people that did not, given where we were.
$1 million
I
is
thought
$1 million
it was-
though. If that's what's
Yeah.
that's now. I mean,
Well, I don't know what feels in town this year.
okay.
On to the town clerk. For the most part, the town clerk is holding revenues pretty much flat. The major one being conveyance fees is staying at 1.5 million. Obviously, it was peaking during COVID and slowly dropping down. FY23's actuals are 1.6. Right now, we're probably going to hit hopefully that 1.6 again. So this is being on the conservative side, hoping we're still sloping slowly downwards 1.5. The only drops here are in the recording fees, 15,000. The MERS town general fund fees are 28,000 down, and copier revenue is 15,000 down. These are just bringing the budget number in line with 23 actuals and what we're projecting off of 24. Any questions on the clerk?
Well, just on conveyance, what's any point of view on that? That's flat, I guess we can.
We have extremely low inventory.
Right.
So we've got 30 cars lined up at open houses on weekends right now.
Are we going to make $1.5 million? What's your crystal ball telling you for this year?
For this year?
Yeah.
I think so.
Okay.
In December, we were, 8.
I keep forgetting this is December, not January. Okay, yeah. Not that a lot sold in January, but okay.
On to building and land use. So I grouped these two together because they were originally in the building department, so it's a little easier to be represented this way. Overall, they're pretty much being held flat. Building permits at 850, and zoning permits 60,000, and 30,000. So, any questions on this?
Did we recently raise our permit rates? We did, right?
Yeah, we just approved them like.
How do we compare to other towns?
We're kind of in
really
the middle.
looked at a
They
long
really
time
do
in the
kind
middle.
of do the same thing Jen did. Everybody they look and try and keep us.
I just don't remember if we did we ever really figure out what the downside was to being on the high side? Like, right? Is there any benefit to being in the middle?
It's not elastic.
Right. I mean,
not at $100 versus $200.
Well, that's kind of what I was good. Okay. But anyway, look, you don't want to be doing that every year. And I think you just visited, you must have, I just don't remember. Okay, so that's flat.
Can we see that though? It'd be good to know what are the numbers, what are the permit costs, and then how do they compare? I think everyone ought to look at them. I actually haven't looked at them in years.
So I can send over, I have the permit cost for New Canaan. I can reach out to Brian Platts and see when the last comparison was done and forward that along.
But how many building permits makes up $850,000 is my question.
That might be in the book.
Yeah, I didn't see it. I
I don't know that we, actually, Anne, I don't know whether we raised Brian's.
Brian did.
You know what I mean?
No.
Oh, okay. We didn't approve that. That was, that's Brian.
Yeah.
So in FY 23, building permits were 2,100. FY 24, 1,600.
So this year, the year when now? Give me the number.
Estimated 1,600 permits issued. Yeah.
No, that's the number of permits issued against 850,000 or against what year to date.
850,000.
The budget is 850.
It's estimating out the whole year.
I got you. So give me the number again. 1,600.
16, say 17.
I'll say 13. Okay. So okay. Sorry. Yeah, exactly. I mean, I'm. $500, people.
So it's not a last.
$600 is do people not take them out? I don't know. I mean, you got to ask. Let's get some benchmarks on that. And we need N. How many permits are making up these numbers as an estimate? It'd just be good to know. So what the average permit cost is.
On to parking. So parking is going down by 5.75%. The main driver here is the permits in your budget are being listed as down 100,000. This number is really truly a flat number, and this is a one-time, much like on the expense side, correction on the accounting side of it. How the parking revenue works is, so we're budgeting for in FY 24, 500,000 in the parking fund, the fund that we utilize to repair parking lots. We transfer over a certain percentage of that revenue, and budgeted in the parking fund is 100,000. Truly, it should have probably been budgeted at 400,000 and 100,000 with a total of 500,000. So that's what we're returning to. That's why when we take a look at it during our financial updates, and they're only getting to 300, 350, 400-ish thousand, they're not really down 100,000. They're really representing what they should be. So this is just kind of a catch-up year for us more appropriately accounting for and budgeting for what that revenue is supposed to be. Tickets, much like on the expense side, tickets are going down 25,000. Less tickets are being given. There's a bigger focus on public education and kind of pointing people where the appropriate places are to park. Meters is up 40,000. This is to reflect an upward trend in the parking meters revenue. And Boxcar is up 30,000, which is reflecting the popularity of Boxcar versus day passes at Talmadge Hill. Any questions on parking? Insurance liability and miscellaneous.
There was talk about raising the parking fees and possibly in the POCD. And I'm not sure if that happens, when that would be implemented. But there might be some upside on the parking revenue as a result of that change.
I don't think she raised the fees.
No, not for this.
Let me see.
So I'm talking about the Jeff Speck presentation where they said you should increase the parking on Elm Street, make it really high, and then the parking a little further out, you should still make it high. And the further out you go, the cheaper it gets. So if that does get implemented, I don't know if that would happen in the 24-25 year.
It's not being accounted for here in these projections. It wasn't approved in the Board of Selectmen fee memo review. So it would have to be done at a separate time, I guess. And then.
Okay, yeah, I'm just saying that's a potential upside.
Can I just go back to the parking for a second? So the boxcar is up, but the daily permits are down. Is that because it's a lot easier to do it on your app or something?
It might be.
You also don't have a covered part that, I mean, you're waiting out in the cold at Talmadge Hill and
A limited amount of
Yeah.
daily, pay daily, and I won't say unlimited boxcar, but there's always availability in boxcar, but not, the pay dailies go pretty quickly in the morning. So there's,
What is boxcar?
boxcar is the parking service, where you can go on your phone and you can reserve a spot at Talmadge Hill in St. Louis. It's $8, I think it is.
Okay, so 6 is good.
Oh.
I think it might be more expensive. Just Talmadge Hill.
Oh, maybe that's right, yeah.
On the insurance liability side, member equity is down 50,000 to 0. Kerma informed us that the town won't be receiving member equity in this coming year. Miscellaneous operating transfers in. Right now, we have kind of a placeholder at 560,000. This is 500,000 of a placeholder from bond premium to offset debt service interest, which we have mentioned earlier, and also 60,000 that represents us closing the dog fund and transferring over some of that fund balance into the general fund. As police goes through their budget, you'll see some of the operating expenses and revenues brought over onto their budgets.
It's a one-time only.
Is that really it's revenue?
It's a fund balance from another fund we're closing down.
So it does count.
It's a one-time only influx for us, yeah.
Okay.
Remind me again, the member equity, is it like a mutual company so that a policyholder gets a discount or
Yeah,
refund?
Kerma gives a distribution at the end of the year, but they had a big claim on a roof that fell. So it kind of killed the.
Because I was gonna say, there's some pretty consistent numbers there in the prior years.
Yeah, they had a big claim on
Yeah, it's a disappointment. Thank you.
That's it for revenue. For capital projects, general fund doesn't really have many capital projects. The one mainstay is the IT department has IT hardware, software, general, WAN hardware, software, and cybersecurity mitigations. So that's 90,000, 80,000, 55,000. Those happen annually. The parking department is looking for a new permitting and ticketing software. That's in there for 62,000 right now. I don't think their current software Passport is kind of fulfilling the needs in terms of reading tags, reading permits, and just being able to have the service and things. And customizability and so on.
Yeah, the renewal process is really difficult.
Any questions on these or was it?
Josh, so the amount of revenue non-tax is down?
Total. That would probably be reflecting also the transfer in from the town's ISF that was in there for last year. So that's a straight million that's not there. Other revenue would be. He was talking about non-tax.
Well, I just, we really want to try to find 2 to 3 million of reduction in expense. And I think we'll have to see what we add up to. You've got between what you came up with, we'll see what we get back from the Board of Ed. And then the other departments we need to find.
Well, the Playhouse is, right, we got a grant.
It's not going to affect the general fund. So it's going to affect the that we bond. Yeah.
Okay. Anything else? Any questions for Ann and Josh on revenues? Michael or Chris? Chris might have dropped. Victor, anybody?
Nope.
No, this,
Good work.
thank you.
And Tuesday, we'll have financials through January?
Yes.
Okay, we'd like to get a status.
Full update or just on the tablets?
You know what, just send it out and
Sure.
maybe.
I'll be ready with.
Let's see where we are. Yeah, I guess my question will be, will we exceed revenues and will we be under budget on the expense side? You can't answer that question just through January, but it matters because it could be another $1 million that if we do have a surplus, we put in the general fund and we could turn around and give it right back. That's what I'm thinking. That could be something, but I just don't know. It feels like should be to the good on revs and maybe under on expenses. So we'll see. That a little surplus would really be a good year to show up with a little bit of a surplus, which I think we should.
Hey, just one question on the revenue, Josh. I was just thinking back on the conveyance fee of $825,000 through the end of this year. Isn't most of the real estate transactions in the spring? So even if you double that, you're at 165, and if you do a little bit more double, you're about 175, 18. Wouldn't you be over the 15? Like, wouldn't you be like 200,000-300,000 above the plan?
Could be.
For 24.
For this year.
Yeah.
Yeah.
You mean for this year? Yeah.
So,
yeah.
Yeah, for this year versus at 15, which means for next year, if it's the same as this year, you should be at 18, not 15.
The better question might be, could we do worse next year? That seems hard to believe.
Michael, remember what Maria said, and there was a big article in the Sentinel last week that John Engel wrote about there's just no movement. There's just no movement.
And there's a lot of people who are not
It's a full page.
downsizing. You don't downsize, you don't have transactions happening.
Well, when people have 2% mortgages from.
Yeah.
That's the biggest block. We'll see. I mean, we're guessing, but it'll be, that's a great point, Michael. We should have a little bit I would expect a little bit to the good on conveyance this year, given what you just said. That's right. And Andrew's going to beat the 2 million. Is he? Wow. All right. Well, any surplus, we'll just turn around and give to the taxpayers.
6 p.m. on Tuesday. Because
Thank you.
First,
thank you.
Pizza at 5:30.
Thank you. Thank you. Good reminder. Okay. If there's nothing else for once, motion to adjourn. Nick's got to do it. He just got on the board. He got promoted. He's bad cleanup. Motion to adjourn.
He doesn't want to.
So moved.
Make the motion.
There you go. Second. All right. All in favor?
He loves it.
All in favor? Aye.
We're good.
Opposed? None. Thank you all. Thanks, Chris. Thanks, Michael. Thanks, Victor, for hanging on there.